Good afternoon, everyone, and welcome to day 3 of the Family Councils of Ontario Finding Your Voice conference. It is my pleasure to be your MC for the afternoon. I'm Sam Peck. I'm FCO's Executive Director. I'm going to start today off by doing our land acknowledgement. Land acknowledgements are important steps towards undoing Indigenous erasure in our day-to-day lives and helps us to better understand and dismantle the continued impacts of colonialism. While we're meeting on a virtual platform today, we are coming to you from many traditional Indigenous territories across Ontario. In fact, there are 46 treaties and other agreements that now cover the territory we call Ontario. And we are thankful to live, work, learn, and care within these territories, and are thankful to the First Nations, Métis, and Inuit people who have cared for these territories since time immemorial and continue to every day contribute to the strength of Ontario and the communities across the province. Our office is headquartered in Toronto, which is the traditional territory of nations including the Mississaugas of the Credit, Anishinaabe, Chippewa, Haudenosaunee, and Wendat people. And I'm actually coming to you from Hamilton, which is on the territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. In all of these regions of Ontario, Toronto, Hamilton, North Bay, Windsor, wherever you're coming from, those are territories of Indigenous folks. And you can learn more about the lands you're on, the purpose of land acknowledgements at native-land.ca. And I encourage you to take a moment to reflect about how you can collaborate with the Indigenous peoples and communities throughout your territory. So I hope you all enjoyed yesterday's day 2 of the conference. If you're joining us for the first time today, a big welcome. We are going to do another little round of icebreakers just to get our energy up and to focus ourselves within this virtual space. So I'm going to ask Dinesh to put the Mentimeter up. There we go. And so underneath the video on your house space, you should see Menti-Lick, click here. If you click that, the first question is, from 1 to 10, what's your energy level today? With 1 being low and 10 being really high. So go in, I'm seeing a couple answers so far. We've got a 5 and a 6. Someone's really awake and engaged today with a 10. See, another 7. Okay. So folks, how are you today? Oh, we got a 4, so maybe a little lower energy. Hopefully you can sit back and enjoy and relax your time with us today. Couple 8s, couple 6s, 7s. Most of us, I think, are sort of in the middle. Hopefully the people who are a 10 out of 10 will help us along our way and participate in the chat. So to pump everyone up. All right, so I'll give you another few seconds before we go on to the next icebreaker question. Yeah, we got a good range. Most of us are in the 4 to 8 area. I'd say I started the day off maybe a little bit lower, but now that we're together in this virtual space, my energy is coming up. Okay, so no one's super low energy, which is good. Hopefully those of us who are in the lower bits will move on up as the day progresses. Next question, another fun one for us. If you could go for a coffee with any figure from history, who would it be? Choose anyone. Real, fiction, historical. Who would you want to have a coffee with? Sit down, pick their brain. Oh, Lao Tzu. It's a good one. Learn a lot about philosophy, culture. Tim Horton, Bob Ross. I have to say, I live a stone's throw from Tim Horton Field in Hamilton, and which is also fairly close to the first Tim Hortons location, coffee shop. So if you're ever in Hamilton, there's some Tim Horton history to see. Bob Ross, hear about happy trees. Shakespeare, really unpack some of the meaning behind the work. I've heard that another vote for Shakespeare. So there's actually some jokes that don't quite translate today, but I'd be curious to hear what they originally meant. Grandmother, that's an important history figure from your history. I think there's probably a lot of our personal friends and family that we'd want to connect or reconnect with. So I'll give you a few more seconds to share your thoughts there. Organize some fun times together. All right. Now we're going to go on to our last icebreaker. What did you learn yesterday? So share with us your key takeaway, something that you found interesting, a topic that you now have more knowledge about. What's your takeaway from yesterday, from your peers, from us, from the presenters? What were your learnings? And we'll give a minute or two for those thoughts to come in. For those of you who've just logged in, we're doing another Menti poll to do some icebreakers and get us situated in the virtual space and learning for today. So the link is under the video in your house space. Okay. Residents' rights, fantastic presentation by Laura Petta from the Alzheimer's Society of Toronto, who walked us through the residents' rights and gave us some really great suggestions on how, as caregivers and councils, we can work to center and really focus and make sure there's adherence to those rights. Equity, diversity, the difference between equity and equality, the importance of inclusion and really acknowledging and centering lived experience. That's the only way we're going to be able to do our work together and to make improvements, is to honor the stories, the experiences of folks living, working, and caring in long-term care. Very much about the impact of family voice. That's why we're here today. That's why it's called our Engage, Empower, Inform. I think I'm getting that right. Engage, Empower, Influence Conference. It's really about having the knowledge you need to use your voice to make a change. Advocacy strategy. Yeah, we talked about how we can use values to better inform the work that we do. And that if we, when we are thoughtful about the process we're engaging in to create change, we should be able to look back at each step along the way and say, what value informed this piece of work? When you're making a decision, you can look at what values you're putting into practice. More work to be done. So perhaps I'll end the Menti poll on that note, because it's an excellent segue into what we're going to be talking about now. So thank you all for participating and for sharing your thoughts there. I'm going to take that down now as I move to introduce the first guest speaker today. So it is my pleasure to be able to introduce to you Jeff Butler. Jeff is the Assistant Deputy Minister with the Long-Term Care Pandemic Response. He works with folks such as Erin Hanna, whose name you may remember. She spoke at our last virtual conference in the spring. And so we're just getting Jeff set up so that way he can give us a few updates and provide some welcome and greetings from the Ministry of Long-Term Care. I've had the pleasure of working with Jeff on some of the work on pandemic response, and can attest that he does care about the family voice and ensuring that the lived experiences of families, residents, and home staff are centered in discussions on policy change and new developments. So without further ado, I'd like to welcome Jeff Butler to the virtual stage. Thank you, Jeff. Thank you for coming.
Thanks so much for having me. So I want to start by Just saying thank you to all of you for the work that you do. Your voice matters incredibly to not only supporting residents and supporting your loved ones and supporting your community, but also in supporting the ministry in really understanding the day-to-day experience of residents in long-term care homes and the day-to-day experience of caregivers and family members and loved ones, and really is important in informing the work that we do to try to make the best environment possible for residents in long-term care homes. I also want to acknowledge the enormous toll that the pandemic has taken on residents, their families, and their loved ones, and on the sector generally. Over 3,800 long-term care home residents have lost their lives over the course of this pandemic, and 13 long-term care home staff as well. And many others have endured long periods of lockdown, separation from their loved ones, and separation from the activities that bring them joy and fulfillment on their in their lives. And we know that this has had a significant impact on their mental health, on their emotional well-being, and on their mental well-being. And the voice of FCO and the voice of family councils and the voice of individual family members and caregivers has been really important in centering that for us here at the ministry, and just really bringing that to the fore and informing the work bringing that perspective to the work that we do. I want to kind of ground that, though, in where we are now with respect to the pandemic. And fortunately, we're in a very, very different place than we were a year ago, thanks to very widespread vaccine coverage in the sector, thanks to the protective measures that have been put in place. Just things are really dramatically different in long-term care. I hope people can see the slides that I have up, but I'll try to describe them just in case you can't. I'm going to start by talking about outbreaks in long-term care homes. Through the first and the second waves of the pandemic in particular, we saw really, really high levels of outbreaks in long-term care homes. And of course, we know that is, first of all, significant in its own right, but also even for residents who aren't directly infected with COVID, having their home in outbreak means, in many instances, being cut off from family and restrictions on activities within the home and their ability to leave. So it's just had a really horrible impact on residents. We reached a point where we had up to 256 homes in outbreak at any given time. In the second wave of the pandemic. As of today, we currently have 2 long-term care homes with COVID-19 outbreaks out of the 626 homes in the province. So while one is too many, I just want to acknowledge the very significant progress that's been made here. This is the lowest level we've seen at any point in the pandemic. Cases as well are also at the lowest level that we have seen in the pandemic. In terms of the number of long-term care home residents that have COVID-19 right now, there are 2 residents in the province of Ontario that have COVID-19 right now, and 4 staff members. And very recently, we've had a few days where there have been 0 resident cases. So just, I think, a really strong indication of how effective vaccines have been, and just where we're at in terms of cases. And lastly, I do want to acknowledge the toll of deaths in the sector as well. In the first wave of the pandemic in the spring of 2020, we were at a point where we were seeing over 40 residents die of COVID-19 every day. This is a very different situation now. We actually have not seen a resident death in nearly a month. October 20th was the last reported resident death from COVID-19. So again, the progress with vaccines and the protections that are in place in homes have just really dramatically changed the picture. And I know that family councils have played a very big role in encouraging vaccinations, not only of residents in homes, but also of staff as well, and also strong advocates for many of the infection prevention and control measures that are in place in homes that are also protecting residents as well. So just a much different picture and very good progress. I want to give a couple of other updates in terms of where we are now. First of all, throughout the pandemic, we've relied very much on a committee that we set up, a cross-sector committee called the Response and Recovery Advisory Committee, to provide advice on the ongoing pandemic response and recovery work of the Ministry of Long-Term Care. This has always been intended as an active and evolving work as we rapidly shift in response to the evolving situation on the ground and planning for different possible future scenarios as well. Sam is a member of that group and a strong voice at the table for the perspective of family councils and family members, and we're so lucky to have her great advice at that table. The work of this group is supported by a number of topic-specific task teams, and their advice has directly influenced the policy of the ministries. I've listed the task teams here on the slide, and the ones with little asterisks beside them are the ones where they've had direct participation, direct membership, either from FCO or from caregiver representatives that we worked with Sam to identify to participate in these groups. Just some examples of how the work of these task teams and the work of the Response and Recovery Advisory Committee have influenced ministry policy and direction in response to the pandemic. One example is our long-term, what we call our long-term care guidance document, which is a comprehensive set of rules and best practices for long-term care homes about that are related to the pandemic. It covers a whole variety of different topics, from screening, testing, infection prevention and control, visitor policies, resident absence policies, all kinds of different things. We receive recommendations from this group that were strongly informed by caregiver and family council voices on screening measures, for example, that they were viewed as really strong protective measures in place, and that active screening of people who are coming in the door to long-term care homes with respect to whether they have any symptoms or otherwise need to be at home isolating is a really important practice and needs to be continued for the duration of the pandemic. So that's something that, based on that advice, we've kept in place, even though the picture's looking overall really good right now. Testing is another area where there has been significant advocacy and very good advice from these tables, including from FCO and including from family councils and caregivers, just about the importance of the protective value of having a testing regime in place for people that are coming in the door, but also balanced against the situation as it is right now, and wanting to make sure that people are able to visit their loved ones in homes, and particularly for fully vaccinated people, a feeling that the risk is low with respect to them at that point, and that we should keep a strong testing regime in place for unvaccinated people, but could ease up for fully vaccinated people coming into homes, and that's been incorporated into policy right now as well. We've also, I think, in response to the feedback that we've received directly from residents and directly from family members about the importance of visits and the importance of residents being able to leave the home to socialize and engage in activities that they love doing, have made really significant changes to visitor policies and absence policies to allow more freedom for people to visit long-term care homes and for residents to be able to go out and do things and get back to some sense of normalcy. And that's been a direct result of the advice from the committee and its task teams. This guidance is going to continue to evolve. This is a living document, and as things change and we need to address new topics, we're going to continue to do that, again, with consulting with key stakeholders, including the Response and Recovery Advisory Committee, including FCO. One example of something we're working on right now that will be that we're hoping to issue really soon is guidance on holiday practices. So I know this is a hot topic right now that there's a lot of interest in. What are the holidays going to look like this year? People didn't really weren't able to spend time with families and celebrate in a way that's meaningful and important to them last year. So we want to make sure that there's clear best practices out there for homes in terms of how to ensure that residents are able to celebrate in the way that they want to, but also doing so in a safe way. So this is something we're actively working on right now and that we want to make sure we get advice on. I also want to acknowledge where we're at with vaccination rates right now. And first of all, just so you understand sort of the scale of where we're at in terms of the protective value of vaccines in homes, but also just acknowledge the really important role that residents and residents' family members have played here. So in terms of resident vaccination, the vast majority of residents, essentially all long-term care home residents who are able to receive a vaccine and wanted to receive a vaccine, have done so, and have received 2 doses of vaccine. And at this point, 90% of eligible residents have also received a 3rd dose of vaccine. So currently, the interval between when you receive your 2nd dose and when you're eligible to receive your 3rd dose is 6 months. So of those residents who received a 2nd dose of vaccine at least 6 months ago, 90% of them have also received a 3rd dose. And I know there's been more reluctance to take up 3rd doses than there was for 1st and 2nd doses, which is why we're at very close to 100% for 1st and 2nd doses and 90% for 3rd doses. The voice of family members and the trusted advice that family members provide to residents on vaccines has been really important in getting this far with respect to 3rd doses as well. So thank you. I know family councils have been working very hard on this, so really appreciate that. On staff, we get reports on a monthly basis directly from homes on their staff vaccination rates. The most recent data we have is October. So as of October 31st, we have 90% of staff, students, and volunteers in long-term care homes that have received at least 1 dose of vaccine, and over 95% actually that have received 2 doses. And we know that number's gone up. As of November 15th, all staff, students, volunteers, and support workers, unless they have a valid medical exemption, have to have had at least 1 dose of vaccine. So that rate, that 1st dose rate would be 100% now, and have until December 13th to receive both doses. So at this point, we have extraordinarily high vaccine coverage amongst the staff, which also is providing strong protection. So that's a bit of a picture of where we're at right now. Lastly, I just want to talk a bit about where we're going, and I don't want to belabor this too much. I know that you've heard from other speakers, including from the minister, about the Providing More Care, Protecting Seniors, and Building More Beds Act, which was introduced last month, and that if it's passed by the legislature, that would repeal the current Long-Term Care Homes Act and create a new Fixing Long-Term Care Homes Act. It's really built around three pillars. And again, I know you know this already, so I won't belabor it. But the three pillars are improving staffing and care, protecting residents through better accountability, enforcement, and transparency, and building modern, safe, and comfortable homes for seniors. The reason I want to mention this specifically here is because I just want to acknowledge that the bill incorporates many of the really important lessons that we learned during the pandemic, including the really important role of family councils and of caregivers. I know that many of you here, in addition to your roles on family councils, play an important role as caregivers to your loved ones in long-term care homes. So I think you'll notice the new act is, or the proposed bill rather, is available on the Ontario Legislature site. You can read it. There's going to be public consultation on it in the coming weeks through the regular legislative process. But if you look at it, I think you'll notice there's it, for the first time, explicitly recognizes the important role of caregivers in supporting residents' physical, mental, social, and emotional well-being and their quality of life, acknowledges the importance of caregivers as part of a constellation of entities and people who support residents and contribute to the well-being of residents. It includes a new resident right as part of the Residents' Bill of Rights to ongoing and safe support from their caregivers. And I think really importantly, like I've been saying, we've seen the incredible value that we've gotten from consulting with FCO and with family councils on the policies that we've developed in response to the pandemic, and as part of making sure that that's an ongoing feature of the system. There's also a new provision in that bill that requires the Minister of Long-Term Care to consult with organizations that represent the interests of family councils on an annual basis. So I want to acknowledge that that's another really critical piece in that bill, and I think acknowledgement of the critical role that family councils and FCO play in informing our policy development, and just our understanding of bringing that lived experience and perspective to the ministry. It's so important. So I'll conclude there. I want to say again, thank you so much for the work that you do. Our relationship with FCO is incredibly important to us, incredibly important to me. We hear every single day from family members of residents in long-term care homes. It helps us understand the impact of what we do. It really does influence and shape our thinking and our policy development and our practices, our operational practices. I know the theme of this conference is about finding your voice, and I just want you to know that from a ministry perspective, that voice is so important, and we want to ensure that we keep hearing it. So thank you for the work you do. Thank you to Sam and FCO as well, and thank you so much for inviting me.
Thanks so much, Jeff. It's always a pleasure to have you join us. Before we wrap up, I have one question for you. And government has a bit of a reputation as being pretty slow to act. Sometimes things take a long time to come to fruition. That has not been the case during the pandemic. Things have gone rapidly. Haven't always gotten it right the first time, but we've worked on it collaboratively. What do you, in your experience, what do you attribute the ability to act so quickly and responsibly during the pandemic? And how different has that been from your previous experiences with government?
Yeah, that's such a great question. And so I think a couple of things. First of all, I know I said this already, but I really do mean it. Like the hearing directly from residents and from their family members all the time about what they were going through and what they were experiencing in long-term care really helped foreground for us the urgency of the situation and of moving quickly, and not only the urgency of moving quickly, but moving quickly specifically on what. So one of the things that I think we would have understood, but I think came to understand much quicker as a result of, hearing directly from family members in particular, just about the toll that the provisions that were in place that were intended to protect residents were taking on their mental health, and the isolation that they were experiencing, and what were really well-intended provisions to try to make sure we were preventing COVID from entering homes was having an unintended consequence of, cutting people off from the things and the people that provide meaning and importance in their lives. So I think having in place processes where we could really quickly hear directly about what the impact of those things was really important. And then I think secondly, just the urgency of the pandemic and the fact that, it moved really quickly. I think there was a broad understanding that we needed to move quickly, and there were new structures created within government to speed up the decision-making process. I think we learned some things about going through this about how to move quicker. And so, I think we'll look to figure out how we can keep that going. I do think the Response and Recovery Advisory Committee played an important role also in helping us act really quickly. And I know some of the lessons that we've learned from that have been built into the new consultative structure created for the Fixing Long-Term Care Plan. And that's also, I think, why you see the provision in the bill about, making sure there's ongoing consultation, including directly with the minister, with important stakeholders, including FCO. So I think it was just getting the benefit of hearing all the time directly from the most impacted people, and also just the urgency of needing to act really quickly in a pandemic, which sort of forced the issue for us.
Mm-hmm. And I think that it also speaks, and your point speaks well to what we discussed yesterday, which is about the need to center lived experience and to really deeply understand the impact of policy, how it plays out on the ground. And I know you've heard a lot from me about that. And also, to your point, we didn't necessarily get it right the first time around, but we meaning, the sector and those who provide input, we're able to acknowledge that and then try something different. So thank you very much for spending the time with us this afternoon. And just more broadly, Jeff is sincere when he says that he appreciates the feedback and needs it to be able to make good policy choices. So I can attest to that. So on behalf of the FCO team and everyone attending today, thanks so much, Jeff. And we'll definitely be in touch the next phase of government initiatives. So thank you again.
Thank you for having me. And thanks again to everyone here for the work that you do.
All right. Now it is my pleasure to introduce the speakers for our next session. They are they're good friends of FCO from the Ontario Caregiver Organization, which, if you don't know, is a nonprofit that is funded by the Ministry of Health, that was formed back, seems like a long time ago, but just 2018, to support Ontario's 3.3 million caregivers in all caregiving settings and locations in the province. Amy Coupal is the CEO. She is, and I can attest to this as well, a visionary leader. She has over 15 years of experience in the not-for-profit sector and has held a number of previous CEO roles, including Learnography and My Class Needs Foundation. You can read more about her in her bio in the agenda and speakers, but I will point out that Amy does have lived experiences of being a caregiver to both of her parents, and supported her brother as well. Joined by her is Alison Kilbourn, who is a project lead for strategic partnerships and innovation at the Ontario Caregiver Organization. She's worked for over 10 years in home care and community support, and specifically the healthcare sector with vulnerable populations. She has done a lot of really great work with OCO. So I am pleased to bring to the virtual stage both Amy and Alison. We're going to give them a moment to get set up, but over to you.
That's great. Thanks so much, Sam. And really pleased to be here with this group today, and really grateful for the opportunity opportunity to also hear Jeff speak as well, because we have some very common interests. And I hope that in the things that we are talking about today, you'll see some of the provincial insights that we're going to share, as well as long-term care specific insights that we're going to share that may feel quite connected to your individual experience. So really pleased to be here with Alison. Alison, I think you are going to pull up our presentation, so I'll give you a second to do that, and looking forward to sharing that information with you, and then also taking some questions at the end.
Okay, I'm just going to share my screen here.
I'll start while Alison is pulling that up by just building on the introduction that Sam made around Ontario's caregivers. And thanks, Sam, for setting the stage on the Ontario Caregiver Organization, who we are and what we do. Alison, maybe you can move us forward here,
Sure.
and that will allow us to share a little bit of background. So we do exist to improve the lives of all of Ontario's caregivers, that 3.3 million that Sam referred to. And these are people who are providing both physical and emotional support to family members, partners, friends, or neighbors. And I will say that we have heard some extraordinarily difficult, personal, and really individual kind of examples of the way that people have experienced the pandemic in long-term care and beyond. It's been an extraordinarily challenging time for caregivers. And I think when you see some of the information you're going to see today from us, I hope it makes people realize that they're not alone. And that's not necessarily a good news story, because the story in and of itself isn't a great story, but sometimes it's helpful for us all to know that we're not alone in these experiences, and to connect with each other as we do things like reach out to people like Jeff, reach out to people like Sam, reach out to people like us to say, okay, here's the help I need, here's the issues I'm having, and how can we figure this out? So let's keep going on the next slide, Alison. So just very briefly, in terms of what we do as an organization, we have a number of different functions that we fulfill. So we provide information directly to caregivers as well as to the public. Many people still do not identify themselves as caregivers. And in fact, the pandemic has shone a lot of light on caregivers and caregiving. But many times people say, I do this because I'm a son, I'm a daughter, I'm a spouse, I'm a parent. And so shining light on that particular caregiving role that people are playing is an important part of the process. And it ties into those stakeholder supports. If you move down from the top center to the left, where we work with a range of stakeholders on something that Jeff touched on earlier, which is really recognizing caregivers as part of the healthcare team, part of the circle of care. And so those supports for stakeholders that enable them to really best understand the role of caregivers and how to engage them, that's a fundamental part of what we do. So raising that public awareness and overcoming some of the key issues that arise in the public domain, including caregiver visitation and access, which has been a huge issue over the last year and a half, stigma and the reasons that people don't feel like they can identify themselves as caregivers, or that they can't get the support that they need. Those are issues that we can address through that mechanism as well. We do connect beyond healthcare and long-term care as well, engaging with education, engaging with workplaces, engaging with all of the different places where caregivers show up in their lives to make sure that there are the supports and understanding that's necessary. And then, of course, we provide a range of programs directly to caregivers, whether that's peer support, whether that's information webinars, whether that's e-learning courses, lots of different ways that we support caregivers directly. And that includes our 24/7 helpline that people can call for information about resources and supports pertaining to their particular needs. So let's move on to the next slide. Today, we want to talk about three key things. I want to share with you some really early news about the Spotlight report that we are releasing next week. So you are actually the first group who's getting this information, because Spotlight is going out on Tuesday, but it's so relevant to this conversation that I wasn't prepared to leave this off the table for our discussion today. So we'll share some of those insights. We'll talk about some of the work that we've been doing in partnership with long-term care, and also the importance of supporting caregiver well-being and how that really ties in with both the insights that we've gained and those partnerships that are so critical as they continue to unfold. So let's go to the next slide. So just to sort of build on that "you're not alone" concept, we do have an estimated 3.3 million caregivers from across the province. And if you look at the age breakdown, we see caregivers at every age, including young caregivers who would be under the age of 25. So you can probably see yourself in one of these categories and recognize that there is a significant population of other caregivers who are there as well, crossing male, female, non-binary, working caregivers, caregivers who don't work, and caregivers who have played that role of caregiver for a significantly lengthy period of time as well. So it is definitely a heterogeneous group with a lot of different people involved. Basically, as diverse as the province is, so are our caregivers. So recognizing that this group is focused on long-term care, I wanted to also highlight, because certainly we know there is a group of caregivers who care for more than one person, and you may have fallen into this category prior to the caregiving that you're doing now, or even currently as well. So we do see a significant portion of caregivers who are providing support to their own parents or their in-laws, as well as a spouse or a partner. And that can include also their own children or extended family members. We see such a wide range of reasons that people are providing care, whether that's related to aging, whether it's related to mental illness, developmental or physical disability, as well as a wide range of health conditions, whether that's back problems, long-term pain, recovery, etc. And of course, we have a new category that has emerged this year, which is individuals experiencing complications from COVID-19, whether that is a COVID-19 infection itself or long COVID. And so this is something that we'll be following. We've been reluctant to share any specific data about how this increases the number of caregivers. And quite frankly, that's because when we've been assessing this, it's quite a wide range. And so until we're super confident in the data, we're not going to tie ourselves to any specific data until we start to see some real consistency on that. So we know that caregivers are such an important part of the team providing care for an individual. And this is one of the most common refrains that we share with people, is that caregivers are a part of the team, just like any of the professionals who are engaged in providing care. And we would like to see caregivers recognized for not only the vital role that they play, but the unique role that they play as the keeper of the information. And in many cases, the most consistent person in the picture, right? Who actually have the best knowledge, experience, capacity to support someone, but they certainly can't do it alone, right? None of us can do it alone, which is why a circle of care is so important, because we're talking about behavioral supports, physical supports, medical tasks, personal care, and even medical treatments. And this is actually something that we are starting to hear increasingly about from caregivers, is how they're taking on some of these things that otherwise might be provided through other clinics, through home care, through other providers in a congregate setting. And so that's something that we're interested in looking at more to see if we can better understand that. So what we've started to see through the Spotlight report as we analyze the data from this year is that, as I mentioned earlier, this really isn't a super good news story for caregivers. The amount of care that caregivers are providing is increasing, and the number of caregivers who are providing 10 or more hours of care per week continues to increase. So in year one of COVID, it was 30%. In year two, it's 34%. And we've seen year over year of doing the Spotlight report that there's a steady increase in the amount of time that caregivers are providing and the number of caregivers who fit into that 10 or more hours a week category. Another thing that we've seen that's increased is that economic contribution. So when we do the analysis of the number of hours that caregivers are spending, if we simply use a calculation based on minimum wage, the economic contribution of that care is estimated at $28.5 billion. So they're an important contributor, which is not why any of us do it. None of us do it because of that contribution to the system. We do it because of our commitment to the individual that we're caring for. But it is important to note the role that caregivers are playing collectively and the impact that that has on the person that they care for and on society at large. So, we've heard consistently in the years that we've been talking with caregivers, they want to do this job. And I can say this for myself as a caregiver as well. In the past, for my brother who had cerebral palsy, for my mom through her cancer and palliative care journey, and now for my dad who's in his 80s. I want to play this role and I do find it rewarding, but that doesn't mean that that there aren't challenges. There really are. So we can have this balance of fulfillment and the opportunity to spend time and provide care for the person that we care for, and that there's a benefit to that, but that we also need support, right? So we can see that the role that we play, whether that's medication management, emotional support, all of that kind of stuff, that those things are vital, but that we can't do this alone. We really need help. And certainly we've heard this from caregivers in long-term care and otherwise, that this is a collective effort and that caregivers must be recognized and included in that process. So let's talk a little bit more about some of the Spotlight data from this year coming out next week. So we have 4 key themes that I want to share with you. Absolutely, unequivocally, we can see from the data that the caregiving role is harder now than it was a year ago and before the pandemic. That by every measure, caregivers are feeling more challenged. So the responsibilities are more difficult, and the level of difficulty, if we can call it that way, has increased over the last year. So some of the things that are challenging around that are about social interaction. And I think that that's probably quite relevant to the folks here because, when you are providing care to someone who is in long-term care in a congregate setting, that social interaction is so important. And the constraints that have been placed on the opportunity to do that in the last year and a half have really been a challenge for caregivers. And I certainly don't need to tell this group. Alison, can you try hitting that hide button and just seeing if we can see the rest? There we go. Perfect. Thanks. So people have also reported difficulty with accessing doctors or other healthcare professionals, as well as challenges with delayed or canceled appointments that just require more effort to access those professionals. So we're hearing that across all caregivers in all caregiving contexts. Let's go to the next theme there. So this is probably, my most stay awake at night stat from this report this year is that we see such a dramatic increase in the number of caregivers who feel burnt out. And when we reach the point of burnout, we are really going to be affected in our capacity to provide care, right? Because now we need care ourselves, and it will become increasingly difficult for us to do what we want and are committed to do as a caregiver. So I am deeply concerned about this 58% of caregivers feeling burnt out. So let's break down a little bit of the related stats to this. 1 in 4 caregivers say they're not coping well with their caregiving responsibilities. And if you think about the fact that we have 3.3 million caregivers, that's a lot of people that are not coping well. We have 3 in 5 who are saying that their caregiving responsibilities are stressful. And that is a huge increase. So 61% this year from 49% last year. And that was already during COVID. So we issued this survey in September. So if you think about the fact that in September 2020, we were already essentially 6 months into having experienced lockdowns, just the whole process of understanding COVID and coming to terms with COVID, visitor and caregiver access and restrictions, 49% was where we were 6 months in last year. 18 months in, we're at 61%. That is a deeply concerning trend for me. And we hear that 2 in 5 caregivers say that their mental health is worse now than compared to a year prior. So that's really, really concerning. And it's one of the reasons that at OCO, we've had such a significant focus on mental health. We have a number of programs dedicated to caregiver mental health. And we also have caregiver coaches, caregiver counseling, our SCALE program that provides learning, group coaching, group counseling, as well as peer support to really help provide people with the supports related to mental health. And if that's something that you feel that you need, I encourage you to visit our website at ontariocaregiver.ca and learn more about that. And then we have working caregivers, and the majority of caregivers are working, and they're really struggling to balance work and caregiving responsibilities as well. This, I think, is quite notable in terms of the financial impact. And this is specifically related to caregiving. So 45% of caregivers are experiencing financial hardship directly related to their caregiving responsibilities. 1 in 5 are using credit to pay for the costs associated with caregiving, whether that's additional care providers, equipment, it could be any number of things. We do see, as I mentioned earlier, 69% of caregivers are working. So that's 2.3 million of our 3.3 million caregivers. And we have so many caregivers who are worried about losing their job because of their caregiving responsibilities. We have a significant volume of caregivers who have considered quitting their job. And half of those working caregivers are also wishing that they had more support from their employers. And that's one of the reasons why we have a number of resources specifically for employers on how can you create a caregiver-friendly workplace, because the case that we're making with employers is when you retain your employees by being a caregiver-friendly workplace, that's a win-win. And we're hoping more and more employers will do that. This is a really important theme that I think is relevant for every caregiver, regardless of how you provide care. Caregivers are deeply concerned about the healthcare system and where we are right now, whether that's nurses shortage, PSW shortage, longer wait times for procedures, diagnosis, treatment. And so this is something that, we really want to work in partnership with everybody who is approaching this problem and link arms and figure out how do we deal with this together, because caregivers are often left bridging the gap, right, when those services and supports are not available. And so we're really concerned when we look at the other stats about the impact on caregivers. Where does that leave us? So I believe, Alison, is this where I'm turning it over to you now?
Sure, I can take over from here. Absolutely. So thanks so much, Amy. And I'm hoping that you also are going to jump in at any point
I will.
to add to the conversation. So I wanted to kind of, in addition to some of the insights Amy's highlighted from the Spotlight report, just briefly talk about some of the roundtable discussions OCO led, actually in partnership with one of the roundtables was in partnership with Family Councils Ontario regarding the national standards. And I know this was discussed yesterday and kind of gave the kind of big picture around some of the survey results, and really, really interesting from the National Institute on Aging. But I think that this just gives a kind of small window into some of the roundtable discussions and some of the key themes that came up when we had when we had those roundtable discussions earlier this fall. So, not surprisingly, I think there was just a general overtone of more recognition and appreciation for family involvement. We again did 2 facilitated discussions, one with the Toronto Caregiver Collaborative, which we have a staff member who is the co-chair for, and then one in partnership with Family Councils Ontario, and that included representatives who are caring for family members in long-term care across a wide cross-section of Ontario in a number of different locations. So I'll just take a moment to just look really briefly at some of the kind of key themes that came up. And we've included just some snippets in the kind of the caregiver voice on the screen here, so you can kind of get a sense of some of the kind of from the voice of caregivers who we met with at the roundtable discussions. So I would say generally kind of 4 key themes came up in terms of the discussion, and one was around kind of the workforce and staffing, and I know that was already echoed in the survey themes that came out from the National Institute on Aging presentation yesterday. So certainly themes related to staffing was just ensuring that people are paid a kind of well-compensated wage that would keep them in the workforce, valued and recognized, and then shifting that also to a broader kind of emphasis on quality of life throughout the resident quality of life. And I think that of course feeds into the involvement of family caregivers, and what that involvement of family caregivers meant looked like, being involved and engaged in policy or programs, being involved and engaged in care plans, in care conferences, moving in, transitions in or out of long-term care when that needs to happen. So there were a number of different kind of concrete suggestions that came out of that level of involvement. And then
Alison, I'll just add to that, one of the things that struck me as caregivers were speaking about these themes that are summarized here is how holistic their thinking was, right? Yeah. They really were looking at, we see the whole picture. That's the role of caregivers, and that's the value of caregivers. And so it was an opportunity to share those insights. But, if you look at the things that are on here, there's actually only one that has the word caregiver on it in that bullet list, right? Because the caregivers want to see the whole system evolve in a way that is in the best interest of the resident, right?
Yeah, absolutely. You're right. And I think one of the kind of last pieces to that, which speaks to all of those elements, are really the kind of focus on the home, like the long-term care home as a home and the home environment. And I know this is not a surprising theme, like this is talked about in the sector all the time. But I think especially in the view of COVID, and this quote from one of the caregivers, that families and caregivers must never be restricted to entering long-term care again, really gives that sense of the importance of viewing the long-term care homes as homes, and thinking about what that looks like in relation to all of those other elements of involvement, quality of life, and the impact on the residents of long-term care. Amy, do you want to add anything else before I kind of move forward?
No, I mean, I think that's a really important summary, and that quote says it all. Because, families and caregivers have such a strong influence on all of these factors, and really looking at residents as individuals, residents as whole people, and at the homes as sort of a whole functioning home that caregivers must be a part of is a really important message to continue to underscore.
Absolutely. So this kind of moves us into kind of the second main kind of piece of our discussion today. And this is really with a kind of eye to partnerships and really what that looks like. So I'm going to talk for the next little bit about some of those partnerships. This is still very much in kind of an understanding of the ongoing COVID-19 pandemic. But I'm going to kind of frame the conversation around the idea of exploring two ways to think about partnerships. So first is obviously the idea that Amy has kind of mentioned already, but really one that you may get sick of hearing by the end of this, is that caregivers are indeed, partners on the care team. They're partners in that care. So that's one way to think about that. And I'll talk about that in a little bit. But then the second idea of partnership is really what this has meant more broadly, and how partnerships between organizations across settings and across sectors has looked like. And so it's a little bit of kind of the story of what we have been working on over the last year and a half, and how those relationship partnerships and broad partnerships has helped us to understand and support the importance of caregivers as partners in moving forward. And how the pandemic has really, I would argue, kind of accelerated a bit of a culture shift towards more family-centered care that kind of can influence a lot of those home environment quality of life pieces. So I thought by starting this discussion around kind of thinking about building partnerships during the pandemic and how you did that, I wanted to start with this quote. And this is from a daughter and caregiver from a long-term care home, People Care Communities. And Debbie talked about her experience with her mom. And I'll just read this really briefly. So she had said, on Christmas Day, my mom contracted COVID-19 and passed away January 3rd. I can't imagine not being there while she was dying. She was there for my first breath, and I was there for her last. I am truly thankful that People Care Management and staff acknowledge the fact that family caregivers need to be present during outbreaks, and being brave enough to make it possible for us to be there. It is vitally important that family caregivers are in the home with their loved ones. So Debbie was a designated care partner, an essential caregiver at the long-term care home. She had been supporting her mom, but prior to that, and then once an outbreak happened, she was able to continue in that vein. And People Care Communities has been one organization that has worked alongside a number of long-term care homes as part of our learning collaborative, which I'll talk more in a little bit about. So,
Alison, just before you go into this, I just wanted to comment on the juxtaposition of this quote with other quotes that we have in the Spotlight report. So for the first time this year, we included caregiver interviews as a part of Spotlight. And some of the quotes are, incredibly tough to hear from caregivers. And people talk consistently about missing or not having access to those milestones that we're all used to being a part of in life, right? Whether that's about death, whether that's about grieving, whether that's about celebration of life, and how vitally important it is that we get to maintain our humanity in that. And so, what I appreciate about this quote with Debbie is she felt recognized as a person, and her mom was recognized as a person on their journey. And I fully acknowledge that there are many people who did not have that opportunity.
Yeah, absolutely. Yeah, I think that that's a great point. And I think many folks here have either experienced this or something similar to this, or the lack of this kind of experience in the last year and a half. So before I move forward, I wanted to first kind of take a step back and provide some context and a bit of a framework for what we know is important, but has now kind of been validated a bit more, unfortunately, through the pandemic. So I always like to kind of set the stage for kind of the idea of partnerships, but why this is even more important. And I'm thinking particularly around the caregivers as part of the care team. So even before the pandemic, there was really a kind of growing body of evidence that that family presence and participation provides many benefits for residents. So caregivers, not surprisingly, offer really more of a deep understanding of the resident, of their condition, that can help other care team members to make better care decisions, to improve quality of life, and has really come down to many other tangible things like the improved quality and safety, reducing hospital admissions or readmissions, decreasing anxiety, confusion, and agitation. I think, just looking at these things, it seems obvious. We can all understand that when you're around your supports, your family members, that those are really key in supporting someone's quality of life and well-being. But in particular, when we think about the impact of visitor restrictions during COVID, that's where we almost see a bit of that kind of vacuum effect. So we already kind of knew this before the pandemic, and it was then even more validated. So, and in the context of COVID-19, and I think Jeff had kind of mentioned this earlier, so many decisions were made in order to protect residents, and really with the best intentions around the safety of residents, but the unintended consequences of that were huge. And even in the second and third wave, the patient ombudsman report, which we've shown up here, the top complaint was still in the second and third wave was visitation. So, and there have been, inconsistent kind of guidance, policies, and perspectives on how that visitation has looked. But increasingly, of course, we've seen that there is now an increasing recognition of the essential role of caregivers. And we've obviously seen that reflected in ministry guidance and directives, and now even in kind of new legislation. So, but I think that this, again, what COVID did was kind of provide this view where this is what life in long-term care and even in other settings looks like without that support. So it provided even more of a highlighted view of the impact of that, of the lack of that support.
Alison, too, the other thing I would add to that is just if you notice how different some of the data is between the first and then the second and third waves, it's one of the ones that moves the least, if not the very least, right?
Yeah.
And so to think that we were continuing to deal with the same issue so long into the case is interesting, and also interesting when you think about the fact that there's actually a growing amount of research data that shows, any perceived benefit is far outweighed by the costs.
Yeah,
to
absolutely.
residents, to their overall health, to their mental health, to their outcomes.
Yeah, absolutely. And one of the other pieces that has come out in some of the evidence as well is the impact on care providers and staff as well, in terms of the kind of anxiety, trauma, and distress experienced from implementing policies that contradict that kind of person-centered or family-centered care, and the kind of moral distress that has made very real for folks who are working in long-term care. So now I want to kind of shift to a bit of a visionary thinking when we think again about partnerships. So this is where we're thinking about caregivers as partners, and a kind of culture shift that really can transform care and can transform that kind of quality of life. So this is really about caregivers feeling consistently recognized, valued, and included as part of the care team. This is about long-term care homes recognizing and embracing the role of caregivers and their expertise, and being empowered to participate as part of the care team in a meaningful way. Having policies and practices that support and encourage caregiver participation in that care, and overall leading to a better experience for residents, caregivers, families, and staff. So I'm asking you to kind of keep this in mind as I talk through, because I think that This is something where we have kind of a vision of the future where it could be like that. And there's moments where this happens, but we want this to kind of consistently happen. And I think what I'm going to talk through next is how we might get there and how we've started to get there. So one of the ways that we've started to do this work is through some of our work related to Caregiver ID and Partners in Care Toolkit. The Change Foundation originally led the development of Caregiver ID along with some of its changing care teams through a kind of co-design process. And this was originally based on some work developed out of the UK, where they had done a lot of work with a kind of Caregiver ID model there. And the Caregiver ID is really a kind of the cornerstone of our kind of Partners in Care toolkit, which organizations are able to adapt, adopt, and use in order to support them in implementing an essential caregiver program or essential caregiver ID, with a Caregiver ID badge. So Caregiver ID is kind of that symbol and that visual recognition of caregivers as partners in care. And even more during the pandemic, it's really been a very valuable tool as that common symbol, because especially, at screening in an ID badge, it has a much more tangible meaning. And I think it can be used as a lever to help kind of increase the momentum of culture shift that needs to happen in order to think about caregivers as partners on the care team. So when we think about some of those benefits of what that Caregiver ID badge looks like, it has meant a really tangible way to show that organizational commitment. It means that there's an enhanced caregiver experience and with meaningful involvement, and hopefully also better staff awareness of the role and importance of caregivers as a partner in care. And then that allows for that greater mutual trust and dialogue between caregivers and care providers and long-term care staff. So again, all of the kind of Caregiver ID has been that piece of the Partners in Care toolkit, which has really helped provide some settings and some long-term care homes who we've worked with in particular to adapt and take this tool and be able to use some of those tools to really support their essential caregiver program that they've had to roll out and to support the caregivers working and visiting and caring in the long-term care setting. So I now want to shift a little bit to a kind of second partner piece. So the first partner piece, again, I was kind of focused a little bit on caregivers as partners in that care team. And now what I'm focusing on is that kind of broader partnership piece. And I want to talk a little bit about the Ontario Caregiver Organization's Learning Collaborative and what that has looked like for our Caregivers as Partners in Care Learning Collaborative. So this started at the outset of the pandemic. Early on, we developed a kind of learning collaborative focused on Caregiver ID as a tool that could be leveraged. We invited a number of key partners. FCO was one of those partners who's been a longstanding kind of participant and actively engaged in the learning collaborative. We started to have these kind of monthly learning conversations, and really then thinking about, okay, how does this look in one organization? How could it be transferred to other organizations? How can one organization learn from others? And a lot of that kind of cross connection started to happen in terms of one hospital or long-term care home taking some of the tools and running with it, providing support and information to other organizations. And then that spread to other organizations. So the momentum started to grow. And this is where a lot of that cross-sector learning really started to happen and was able to kind of gain momentum. So by the second wave, during the second wave, I think many organizations were better prepared to reintegrate caregivers into their care setting, including many of the long-term care homes. And then we started to see a little bit more uptake in terms of how the essential care programs could be leveraged and how Caregiver ID specifically could be a tool used to do that. So we now have over 25 settings have implemented Caregiver ID. We have a number of Ontario health teams who are in the process of implementing and have implemented Caregiver ID. Many organizations are thinking now at the point of implementing more broadly a partners in care approach using a Caregiver ID symbol. And this is where we then can look to kind of continued learning and continued partnership across sectors, because the long-term care sector has also been able to teach the hospital sector. The hospital sector has been able to teach long-term care, and the community sector has also been able to be in the mix in terms of providing some insight as many caregivers are supporting folks living in the community as well. So what I think that this looks like in the long term, and what we want to think about it now, is that the pandemic has provided this kind of, again, vacuum of space where folks were in a highly restricted environment. People were separated from their care partners, from their caregivers, from their families. We saw the impact, the unintended consequences of that. But then we also saw an opportunity to recognize the essential and incredibly valuable role that caregivers play in supporting long-term care residents. So now we have an opportunity to look further. And as we look beyond the pandemic, looking at what that sustained culture shift looked like, thinking about how we want to get to a place where all long-term care homes embrace a culture that recognizes and supports caregivers as true partners in care, and recognizing, what that looks like and what that feels like. At our last Learning Collaborative, we had a bit of a focus on long-term care, and we had one of our care partners from a Grey Bruce long-term care home, Lee Manor, who spoke so well about her own experience supporting her mom in long-term care. And one of the things she noted that I thought was such a great example was that, as you know, she was now used to the change, going in and out, the doffing of all the gear. You know, she was a very active member on the family council herself, but she noted that, in recently, partly because of some of the kind of staffing shortages, there had been a number of staffing turnovers, and she just noted very clearly that it was her and her sister who were the most consistent presence. They knew her mom the most and were able to provide that consistent presence and consistent voice and introduce staff to her and her care. And I thought that was such a great example of thinking about what that looks like on a day-to-day level, but what that sustained change needs to look like in terms of recognizing that role as a true partner in care. I think we're still not there. So that's where I think that I really invite folks to think about joining the conversation. So our Learning Collaborative is an ongoing learning piece. We actually have another open house session on December 1st coming up, and it's looking ahead at sustaining meaningful care partner presence beyond the pandemic. That's one place you can go, and I'll make sure that the invitation to sign up and register for that event is shared in follow up after our presentation. The other piece which I invite folks to check out is the Essential Together Pledge. Healthcare Excellence Canada has done some excellent work pulling together resources, tools, materials for ensuring that organizations are committed to family presence in care settings. And there's a pledge that organizations are asked to take in terms of committing to reviewing and co-designing those policies alongside family, and making sure that those essential together policies are looked at. So before I move forward, I want to spend our last little bit just talking a little bit about in terms of what this kind of whole partnership means. And this is kind of connecting the dots with some of those insights that Amy talked about at the beginning, and shifting to supporting caregiver well-being. And I think, you know, I won't spend too much time on this because I want to make sure that there's time for questions. But I think that I'm just going to kind of leave us with some kind of simple thoughts about how important it is to support that caregiver well-being, especially when we're, you know, also trying to ensure that caregivers are recognized as part of the care team. It also means that they need to be supported in their role as a member of that care team. So, you know, Amy has gone over it with such great, you know, really recent information from our Spotlight report, the real impact of caregiving. It's 24/7. It has a really significant impact on your life. And, you know, there are very real risks of burnout. And I really love this, this quote because, you know, I think it's not surprising. And this is actually a caregiver talking very positively about her own reflections, supporting her partner as they were dealing with a chronic illness. And before she said this, when she talks, she had said, actually, we had a really great experience, you know, in the healthcare system, but that no one had ever said, you know, how are you doing? And kind of shifted that conversations over to her to kind of say, to pause and say, you know, how are you doing? And how are you coping with this? So this is really an invitation to folks working in long-term care and working alongside caregivers, is to ask caregivers how they're doing, include caregivers as part of the care team, make sure to share what's happening and what to expect, encourage caregivers to visit the Ontario Caregiver Organization website or call the helpline. But I think that, you know, if there's one takeaway, it's just to take those moments and pause in the conversation and ask, you know, how are you doing? Do you need anything? How can I help support you? And then on the flip side of this is thinking about it for caregivers themselves. So when I think about, you know, all of the kind of worries and pieces and tasks that are ever present in your life, thinking about some of the very tangible ways to accept and reach out for the support are very simple messages around being involved, getting informed if you're feeling out of depth. OCHO has just an enormous number of resources and toolkits to help prepare you for some of the more difficult conversations or navigations as you're caring for someone in your life. Use resources to support you, but continue to try and take that partnership approach with others in a care team and in the long-term care setting. That is the end of my formal slide presentation. So Amy,
Alison, I'll just add,
yeah.
Yeah, I just wanted to add one quick comment on that slide that you were just sharing around supporting your own well-being. You know, one of the things that I'm personally aware of and that we hear about from caregivers all the time is that caregiving is not a linear journey, and that the kinds of things that we do as caregivers really evolve over time. And so, you know, I think what we are asked to do at least implicitly, usually not explicitly, is adapt to different circumstances during transitions or as care needs evolve or whatever the case may be. And so, you know, as we build more and more content, and there's always new things going out, what we want to do is have tools and resources for people throughout that journey, right? So whether you're a new caregiver, an experienced caregiver, a caregiver at home, a caregiver caring for someone in a congregate setting, all of those kinds of things. And so if you're reaching a point where you're like, my old strategies weren't working, or I just need new strategies because the landscape has changed, there might be something for you. And so, you know, we've talked about caregivers as partners a lot today. And one of the things we've recently added to our suite of offerings is an e-learning course. We have a couple of courses for healthcare professionals around recognizing as caregivers as partners, but now a course for caregivers around, so what does that mean to be recognized as a partner, and how can those conversations go, and what could you do to bring the ideas, the questions, the concerns that you have to the table to really be recognized as part of the team. So I encourage you to just sort of, you know, go through that process, but also realize that, you know, if there's something for you now, there might be something else for you later, and that's a process that goes on over time. And if there is something that isn't there, we also want to know that. So I think, Alison, you maybe have contact info coming up,
Yes.
And maybe we'll leave that up for a bit just to make sure that people have the opportunity to get that down. But if you do take a look at what we have on offer and it doesn't have what you need, we would also like to know that too. And whether it's a collaborative solution that we work on with SAM and FCO, whether it's something that we can support amplification or whatever the case may be, we really want to know what else it is that people need. And so please do keep us posted on that. So Sam, I think we were maybe going to consider some questions. I'm not sure if where we are timing wise, but we're open to questions. If there are questions or if there's time for questions, and just let us know.
Yeah, absolutely. So thank you very much for that presentation. I've been involved in some of the learning collaborative work, and OCO has supported some of the work that we've done as well. So I'd say one of the silver linings of the pandemic has definitely been partnership building, in addition to the recognition of the role of caregivers. So on that note, one of the questions from the audience is, so their long-term care home is implementing the Caregiver ID program. It's slow going, but it's happening. So so there are tools available to support the implementation. So we'll make sure that those are posted to the conference site. But also, People Care is sort of a gold standard, gold star example of implementing the Caregiver ID program. From your experience, from them and others, what role did either the family council or just family caregiver play in driving the implementation and the uptake of that?
Thanks, Sam. That's such a great question, and I actually think that family councils have such a kind of real, very tangible, and really valuable role to play when thinking about some of those implementations. And I think some of many of the long-term care homes and other care settings who have had a lot of success with implementation is when they have really involved family councils or patient family councils in the kind of hospital realm in terms of co-designing and really looking at it. So, like there's tools, there's things that can be at, templates out there, but everyone needs to take it in their own setting, in their own home, and say, okay, well, how is this going to look here? And how is this going to look for our environment? And I think that that's where, family councils can play such a, it's such an easy thing to do. Like just involve the family council and make sure that, because that voice is so important. And I think many folks who have had success are aware they have really done that from the outset. Something we have heard over and over from our partners is, engage early, go wide, go far and deep, like include everyone in that level of engagement, including as many stakeholders as possible, really has helped to make it more meaningful and ensure that it really has kind of sustainability and staying power.
Absolutely. And there's another comment, and I think you've spoken to this as well, is really the broad definition of family and family caregiver, and that it's really, whether it's biological, adopted, chosen by marriage, whatever that relationship is it's defined by the person receiving care and their circle. And
yeah, I mean,
broad.
we do clarify that we tend to not say family caregiver, and for that reason, because people assume that it means biology or some other kind of set of parameters. But when we use that term, we try to always define it as that broadest possible instance, right? Because it's the people who've chosen to play that role in your life, and they may come from, your choir, they may come from across the street, they may come from your chosen family. And so caregiver is, it's the patient or resident and the caregiver who've come to that understanding, right? That's who that is.
Yeah, and we our sessions yesterday, so yeah, absolutely, and we talked a lot about equity and how that equity is really having the needs and the desires and the solutions be driven by the person who's most affected, to elevate those voices. It says this conference, the theme is finding your voice, or finding better ways to use it. So I think that's an important point. We have time for one last question, and this is one that's future oriented. So let's say a pandemic, an epidemic, or we're living through climate change, and we've seen what's happening in BC with communities being cut off. The next time whatever the crisis is occurs for long-term care, what would you suggest as involving caregivers, making sure visitations maintained without risking health of folks? And that was the reason for initially shutting the doors, was we don't know enough about this pandemic. We need to be really careful. So what would you say would be your advice for going forward to be better prepared the next time something happens?
Well, I actually think part of this answer to that is about what we do now, right? Because the more agreements we can do now, or in a period where we're not so significantly affected by the waves, that's how we get to inform the decisions, right? So then there can be scenario plans, and then commitments can be made, right? And so this is the opportunity where I'm hoping that there will be those conversations that say, we won't exclude family caregivers under any of these circumstances. Or that, to Alison's point about co-design, if there are instances where that's going to happen, the caregivers get to be at the table to be a part of that planning and discussion, right? The other thing is about choice, caregiver choice, going back to your point about using your voice. As much as we heard from caregivers who felt significantly the impact of the exclusion, some people did not feel safe, right, to participate in different ways. And so part of it is, what are the choices that people have that are available, right? Because people really ran into challenges because they wanted to be there and they didn't have that choice or opportunity, right? But then for other people who that's not possible because the roads are cut off or whatever it is, what are the variety of options? So I think, the best thing we can do to avert challenges in the future is actually to plan for them. And even if we don't have the answers because we don't know what the questions will be, we should be prepared to have the right people at the table. Right. Mm-hmm. So you've been a huge voice and participant in this. The structures are set up. So if something new emerges that we didn't think of before, how are you? How are other family caregivers? How are people who are vested in this at the table to deal with these solutions immediately, not later, right?
Absolutely. Alison, did you want to add anything to that?
Yeah, no, I was just going to add, and I think Amy's gotten frozen, but now you look unfrozen, Amy, so that's good. But I think the other piece, I know you and I have talked about, Sam, is the idea of exactly that mentality. Amy is doing the work now. And my hope is that we're like it's still real, and even the first and second wave are still close enough that we can use that sense of urgency and kind of lessons learned to inform the future and really kind of crisis proof our policies, our practices, and really make sure that those pieces work together to support that kind of quality of life. And now, because now we know what the impact is with that loss, what that vacuum looked like. Now we have that understanding, we can really build on that.
Absolutely. To start now, to plan ahead. I know climate change isn't going anywhere, and there's going to be impacts on vulnerable people, older adults, long-term care residents, caregivers who are juggling a lot. There's going to be other crises that emerge, unfortunately. But the more prepared we can be, to your point, and creating the space now to build relationships, so that way you know who to reach out to when something does occur, will definitely serve us well. Whether it's responding to a crisis or being proactive to create better systems and solutions. So that's fantastic. So I think I'll wrap up now. Thank you both very much for your time with us today, and the relationship that we've been able to build before the pandemic, but very much throughout the last 20 months, I'd say. I think that, oh goodness, Amy and I have seen each other every couple of weeks at a standing meeting, so we're in touch quite a bit, and it's always good to be able to bounce ideas off of each other, just like a family council. So Amy and Alison, thank you so much for all of your work today in the sector more broadly, and your support of family councils.
Thanks so much.
Thanks for having us, Sam. Great to be here. And I will add that always one of my greatest pleasures is seeing what color will Sam's hair be. And I enjoy that. So it was great to see you today, color coordinated with your curtains. And congratulations on this event, and looking forward to following more of the dialogue and ideas that come out of it.
Thank you to both of you very much. We're going to go into a 10-minute break now. We'll say that I do enjoy changing up my hair, and it amuses me and it entertains the folks that I work with. So it's a win-win. But we're going to take about a 10-minute break, coming back at 2:45, building very much on what was discussed, the impacts of the pandemic and the caregiving experience on folks. We're going to be moving into a talk on mental health and resilience by certified resilience practitioner, David Donaldson. So you've got 9 minutes, take a stretch, grab a glass of water, check out a networking room, connect with your peers, and we will be back at 2:45 with our next session. Welcome back, everyone. It is my pleasure to introduce our next speaker to the stage, the virtual stage, as it were. David Donaldson is going to be giving a talk on mental health and resilience. I've known David for a few years now. He taught me how to do needs assessment in adult learning and development. And since then, we've stayed in touch. He's an incredible speaker and facilitator. I can attest, a good trainer. He's a consultant. He's an author. He's got over 25 years experience supporting organizations in learning development, change management, adult learning, performance improvement, and resilience. In his spare time, he's a man of many talents. He's a pilot, flight instructor, safety officer, horse breeder and trainer, hiker, builder of kayaks, and is an incredible lifelong learner. Almost makes me feel bad, but not really. And I am thrilled to welcome him to the virtual stage for a really, really important talk on mental health and resilience. Welcome, David Donaldson.
Sam, thank you so much. It's always a pleasure when I get to work with you. And just as we get started, I just want to do a shout out to yourself and your team. It's been an absolute pleasure working with Dinesh and the rest of the team. But just attending the conference over the past 2 days and also the music event opening it, you've put together such a wonderful program and a wonderful balance. But what really struck me as I was listening to Alison and Amy talk just before me, 58% burnout. That is staggering. I mean, it's not surprising in a lot of ways, because as we're going through this pandemic, as we're looking at an already stretched healthcare system, it's no surprise that we've kind of reached, if not past, that tipping point again. But the piece that really, really stood out for me was that quote on the end, and it gives me shivers a little bit. No one ever said, "How are you doing?" And this is what we want to do today. This is what we do want to do right now, is we want to ask that question: how are you doing? You mentioned, my experience as a pilot, and something that I always take as a bit of a guiding light for me is that whole put your own oxygen mask on first before assisting someone else. And I was actually going to use that to open, but since I heard that quote, I'm going to change it ever so slightly, because we as pilots do something even before that advice is given to the passengers. We run a checklist that's called I Am Safe. And we check in with ourselves. Are we ready for this? Are we fully here? Are we able to move forward and go down that path and that journey and that flight and that day? And that's something that I love folks who are on our session today to think about. If you are not there, you are of no help to those other folks that are in your care. So I'm just going to use that as a bit of a context and a bit of a frame. So we've been seeing a lot of great statistics and studies and assistance and how to assist in the care. But what I want you to think about is, how are you doing? And resilience is all about ourselves and our personal resilience. So to frame this up, I'm going to start off with this image. And if you go to the workspace, you'll actually see it showing up just below the live stream. So just scroll down just a little tiny bit. And what I'd love you to do is pop into the chat there on the reactions and just put in your reaction. How do you respond in times of disruption? Now, we have a whole collage of pictures here. Sometimes people are, you know what, it's the fishbowl, it's an opportunity. I'm taking the big leap, that leap of faith, hoping I'll land in a bigger fishbowl. For some folks, it can just be the whole, you know, the head in the hands. You know, how am I going to do this? What does this look like? Others, it's that grand sense of adventure. I'm going to leap off the cliff. I'm going to dive into the abyss. But regardless of how we see it, there's often a Gordian knot here. How do we unpack this? And how do we find that all-important balance? So take a moment to reflect on the image, the collage. Think about how you respond during change or during disruption. And I would love you to just pop that in. We've faced a huge disruption in our lives over this past 2 years. And I'd love to hear from you around how you respond in times of disruption. So while we're waiting for some of those responses, oh, there we go, our first responses, yay. Pause, readjust, adapt to the situation. I love it. And Emily, that element of pause is so key. Oftentimes we leap and we haven't thought about the consequences. We haven't thought it through. I need to get a little bit of, let's think about this. From Cathleen, I used to get frustrated, and just listen to that tense. I used to get frustrated, but now I just let it go. I cannot control. I laugh. I try to find the humor in the situation. Love that, Cathleen. We're actually going to come back to your opening words of the I used to get frustrated at the end. Love it. Danny, slightly freaking out, but then adjustment as needed. Love it. Yeah, and absolutely, Danny, it is okay to have that initial reaction. The question then becomes how do we move forward? Meditation, returning to a trusted routine from Dinesh. Love it. Sam, focus on trying to find solutions at hand. Sometimes try the determinant of my own well-being and emotional processing as I try to find and fix the problem. Absolutely. And we want to find, again, that balance, right? How do we solve the problem, but also take care of ourselves? From Tiffany, avoidance, frustration. Yeah, very, very common response. Trying my best to navigate. Oh, and I love this, the fight or flight response. We're going to dig into that a little bit, Tiffany. Love it, love it. So we're going to leave this up, and I'm going to invite you to continue to share your responses, because it's important for us to think about this, and it's important for us to share this and to recognize that it's actually okay. You know, these responses are all good. How we deal with them, how we process them, how we move forward becomes the bigger question. So again, how do you respond during those times of change? Now, let's do a quick little definition of disruption. So here we have a disruption, and a disruption is something that is not what we expect. March 2020, we expected to be, driving down the road, commuting to work, being face-to-face in the office with all of our, our colleagues, to visiting our loved ones. Instead, we went into this lockdown. So things were not as we expected. Now, this chart here, and this is a graphic representation, we're chugging along doing our things. We're in that zone of productive. The disruption hits and we react. And sometimes that reaction is very large, and sometimes that reaction pushes us into the unproductive area. Over a period of time, we recover and we get back into that productive zone. The goal here is to take the disruption, to take the recovery time and shorten it, to make the disruption less. And the more we can do that, the more resilient we are. And resilience is all about staying productive during times of disruption. And we're going to be using a muscle analogy. We're going to be using a fitness analogy. The more fit we are, the quicker we can respond, the quicker we can recover, the quicker we can get back to what is our normal. Now, we're going to look at this both from an acute and a chronic perspective. And when the pandemic hit, I saw a huge fundamental change. And there's a big opportunity from a research perspective around how people respond to this. But there's also a huge opportunity for us to better understand ourselves and how we respond in times of disruption. Now, an acute disruption is something that's short, a snowstorm. And this is how many people responded initially during the pandemic. You know what? We're going to hunker down. We're going to press pause. We're going to wait. It'll be a few days, a couple of weeks, month on the outside, and we'll be back to normal. And, those weeks went by, the months went by, and it was not the case. Quickly realized that we were not in an acute situation. We were in a chronic situation. So when we think about how you run a sprint versus how you run a marathon, a snowstorm is a sprint. It's a short, we can often pull out the reserves. We can go at it. We don't have to worry as much about that longer term pace. A marathon, on the other hand, we need to manage our energy. And I love these two images here because you see in the sprint, there is nothing being held back on this. And you can just see it physically in that whole, in the stance of the body versus the marathon. It's much more of a pace. And I was just noticing Nicole's response, my initial reaction to run away. Love that. It's about how we run away now, right? So as we think about now a year and a half coming into 2 years in, we need to be pacing ourselves. We need to be managing our energy. We need to be coming forward in a way that's going to enable us to sustain and continue forward. So when we think about how we respond in times of disruption, if it is an acute disruption, if it is a very short term, it's that snowstorm. It's going to be a couple days, a week or two. We can pull the all-nighter. We can push through. We can arrive absolutely spent and exhausted. But if it's going to be a marathon, if it's going to be something more than, say, 2 weeks to a month, we need to really pace ourselves. We need to think about how are we going to manage our energy? How are we going to make sure that we're not pushing ourselves too fast and too hard so that we can actually arrive at the finish line? And I don't mean like win. I just mean arrive, right? Because it's talk to any marathon runner and ask them how many races they've run and how many they've finished, right? So there's that whole side of it. So the beauty thing is, though, and I'm going to take this back to the comment made earlier about initially, or I used to do this, is we are complex and adaptive humans. We are absolutely complex. Everyone is different. We have different histories. We have different DNA. We have different, outlooks on the world. But not only that, we are also highly adaptive. So one of the key messages I want you to take away from this session is that you have resilience. You absolutely do. We're going to look at a 7 muscles model. All of us have those 7 muscles. Some of us have developed them more than others and different muscles in different ways. But we are also highly adaptive. So you are a different person at the end of this 2-day conference than you were at the beginning of this 2-day conference. You have learned new things. You have looked at the world differently. I was attending a conference about, it was last weekish, 2 weeks ago. And someone said something in it that was just like very profound and very much like, wow, that is an amazing way to look at that. And I now look at the world slightly differently. We are constantly changing and adapting. So as we think about that in the context of resilience, one of the biggest key factors for building resilience is actually time and experience. This is where we see reactions like, I used to do this, now I do this other thing. And it's a very common thing where over time we build that experience. Every new experience is very scary for us. That's the disruption part. It's not what we expect. We may not have some clear expectations because we've never been down that road before. As we go down that road, it becomes more comfortable. It becomes more manageable. We know what to expect. So we tend to adapt as we go. And what's happening here is our brain is actually rewiring itself. And this is a process known as neuroplasticity. So I want you to think about for a moment what it was like to learn how to drive a car or ride a bicycle or play an musical instrument, any new task. It was difficult. It was awkward. You're trying to, do the fingering and strumming, and it's just, how do I do all that? And then you practice it and you practice it and you practice it. And the more you practice, the more your brain rewires itself and it creates the neural pathways and strengthens the neural pathways. So the more we practice, the more we get it. And our brain says, hey, let me make that easier for you. Now, if you want to experience this, a super easy way to experience this is put on your coat. So I'm right-handed, so right arm goes in first, then my left arm. Try doing it the other way. Put your left arm in first and then your right arm. And it's super uncomfortable and awkward. And then keep doing that for the next month. And what you'll find is that it becomes absolutely comfortable and easy because your brain is saying, oh, you're doing this a lot. Let me help you with it. So the more we get to practice these things, the easier, simpler, more comfortable it becomes. And that concept is really key when we think in terms of resilience, because while you might not be really resilient today, you have the ability to build those neural pathways, to strengthen your resilience muscles. And what we're in fact doing is we're responding to stress. And we're going to look at stress in a couple of ways. But as we exercise, we stress our muscles. There's a recovery time. And over time, that builds muscles. The same happens with our resilience. Now, when you have optimal stress, so this was some work done in the turn of the century, and it's known as the Yerkes-Dodson's law. When you have performance and you plot your performance against stress, arousal, if you are bored, so I want you to think about a time in your life when you've been bored. You've been sitting at home, you don't have a looming deadline. And I know everyone's going, gee, I wish I could have one of those. You've got a time when, it's kind of a down period. Your performance tends to drop. And if you've ever heard that expression, if you want good service, go to a busy restaurant, right? It's kind of counterintuitive because you think, well, if they're busy, they're not going to be too busy to give me good service. If they're not busy, I'll get better service. But what happens is as we increase stress, we increase performance. And this continues to go up until we hit this point of optimal performance, optimal anxiety. After that, we become overfaced. It's too much. And now we start to get into that high anxiety piece and we start to actually degrade our performance. The challenge here is that this point of optimal anxiety, this point of optimal performance is different for different people. And as Sam was introducing myself, she mentioned how we met through some training courses that I was leading. And one of the biggest, most important things that we do as facilitators is we manage that point of optimal anxiety, is we load up the students so that they get, that increase in performance without giving them too much. And as healthcare providers, we can actually leverage this a little bit to our advantage because, of course, if we're coming into a situation and we judge that that person has gone past that point of optimal anxiety, has gone past that point of, I'm out of my comfort zone, I'm overfaced. We need to help them de-escalate and come down a little bit before we can really, have them receptive to be able to learn or to accept our assistance. And as we think about this, we're going to look at this in the context of what's going on in your brain. And as humans, we effectively have three brains. We have our brain stem. That's our autonomic function. This is blinking, breathing, heartbeat. This is the basic stuff that just keeps us alive. Then we have our emotional brain, sometimes referred to as the midbrain. And it is the emotional response part. So this is the sort of the simpler portion of the brain, the more reptilian end of it. And this is all about reactions. This is all about, quick thinking. And then we have our neocortex, which is the outer portion of our brain. And the neocortex is all about perceiving and reasoning and language. And this is where we do all of our higher level thinking, right? And that's if you look at a picture of the brain, that outer lumpy layer, that's the neocortex. And this is those neuroplasticity links. This is the neural pathways we were talking about a few moments ago. So as you exercise your advanced functions and do things like learning to play the piano, learning to drive a car, learning a second language, doing math, things like that. This is all that executive function, that higher level language. Now, our reactionary brain, sometimes referred to as a reptilian brain, this is the fight, flight, food, friend response. This is I'm just going to instantly respond. And this has served us very, very well for thousands and thousands of years. But it's really designed for immediate and visible threats. So we see that saber-toothed tiger bounding across the savanna towards us. Our fight-flight response kicks in, and it has saved many of our ancestors and helped us get to where we are today. As our brains evolved and we developed our neocortex, we kept this fight-flight response. And what happens is when triggered, your fight-flight response starts to take over. And in effect, what happens is we shut down some of our executive function in favor of the quick instant response, to the point where we can actually lose our ability to think rationally. Now, keeping in mind that that portion of our brain includes our speech centers. So if you ever get scared, like really scared, really triggered, you can actually lose your ability to talk. And you'll find that it's difficult. You'll be like, oh, I'm searching for the word. What is it? I'm so mad at this person. I just can't express it. And that's what's happening, is you're getting what's referred to as amygdala hijack. So our amygdala is that portion of our brain that is it's our radar, it's our threat response, it's our, we need to activate and run. And when that gets triggered, we literally become dumber. So there's chemicals released in your brain. They start to shut down your executive function. You start to lose options, and you start to get into that very fight-flight response. So if you're dealing with someone and they become very binary, they become very all or nothing, they become very argumentative, high possibility that they'll experience this fight-flight response. Now, you can also experience that yourself, and many of us have. So how do we combat that? Well, let's take a look at some strategies for de-triggering, because what's happening is we've triggered that response. How do we de-trigger that? And depending upon how far it's developed, it can take up to 20 minutes. So one of the strategies, it's a really good one, is actually to take a break, right? So if you're in that conversation, if you're in that meeting, things are starting to escalate, we want to de-escalate, one of the strategies is actually to take a break, to give people time to come down and relax and de-trigger a bit. So a couple of other strategies. First one I want to just touch on briefly is tap into gratitude. And we cannot hold anger and gratitude in our brains at the same time. So when you tap into gratitude, it's a great de-triggering mechanism. I was working with a gentleman some years ago, and I touched a button on him. Didn't realize I did. And he seemed annoyed. So I asked him, and he, lashed out. And first of all, I apologized. I said, you know what, Tony, I really appreciate what you do. I think you're doing a phenomenal job. And my critiques are not criticisms. They're to make it better, because I know you desperately want to make this a really good system, and you're working very, very hard, and you're doing a lot of really great stuff. But I'm seeing here opportunities for us to do even better. And what I really like to do is build on your fantastic work, because I really appreciate what you do. Now, I didn't realize exactly what I was doing at the time, because I hadn't gone into this field of research yet. But what you could just see him relax. You could just see the de-escalation flow over him. His shoulders came down, the tension and the anger just flooded out. And he paused and he thought, yeah, you're right. And, we repaired the friendship. In fact, we not only had a better working relationship as we continued forward. You tap into that gratitude, get people to express gratitude, or you even express gratitude to them, and it can help really bring things down. Now, especially in the work that you do in terms of caregiving, there is a lot of gratitude there. There can be a lot of frustration at the same time, but there is a lot of gratitude there. And if we can tap into that, we can start to, help bring people down. Another way is to access higher functions. Now, accessing higher functions can be things like doing recall, doing memory. So, asking people what are some of their favorite memories, asking them to do, and this will sound kind of a little bit odd, but, asking them to do math and just asking them to do problem solving or visioning what we can do, to solve this problem. And what it does, because remember, in that state of triggering, we're losing our executive function and we're gaining the fight-flight response. By accessing higher functions, what's happening is you're tricking the brain, because you're now requesting access of the executive function. And this is where you're actually tricking the brain a little bit, because it's like, oh, I need that area, so let me give it back to you. Let me start to release it a little bit. A number of you said, take a deep breath. So I'm just noticing, Nancy, take a deep breath, right? Oh, seek nature. Love it. Yeah, sleep on it. Those are some great options. Now, Nancy, what you're doing when you take a deep breath is you're actually tricking your brain into telling it there's no threat. When our amygdala triggers, we get cortisol released, we get adrenaline released, we get norepinephrine released. And these do a number of things to our body, one of which is to shut down that executive function. But it also, we get adrenaline release because we need to get ready for the fight or the flight, right? We get cortisol release because we're getting ready for the injury. And when we get triggered, we tend to tense. And one of the first things we do when we tense is we breathe shallow, right? We'll tense up our chest, we'll tense up our diaphragm. And what we'll do is we'll actually lose our breath a little bit. We'll tend to breathe very shallow or even just hold our breath. Here's the thing. What's the opposite of that? A nice deep breath, yeah? And if you try that, go ahead and try it. You find it's like, wow, that's calming, and it feels like, your brain clears. And I've used this with my pilot students. I get pilot students who are very nervous and they get very tense. And in the particular airplane I fly, we actually sit one behind each other. So I can see their shoulders, I can see their back, and I'll see them all tensed up. And it's like, hey, Sam, yeah, take a breath, nice deep breath for me. That's it. Drop your shoulders. And all of a sudden, okay, now I'm starting to be able to see better. I'm starting to be able to actually regain some of that important executive function. So Nancy, one of the number one ways to de-trigger is take that deep breath. And here's a really cool trick. As humans, we have the limbic system, which is our emotional link to everyone. This is our open loop system. And we use it to connect with our people around us. And this is how, if you've ever had that experience, this is how when someone walks into the room, you're in the meeting, they walk in the room and all of a sudden the mood just changes. Like it's like the air got sucked out of the room. That's your limbic system at work. It's an open loop system. It connects us all together. If you get into a very tense situation with another human and you do the big deep breath, the limbic system is going to read that. And it's going to say, oh, okay, we can de-escalate, right? Because if I walk in tense and brace for impact and triggered, that's going to transmit there's a problem, there's danger, and our wonderful limbic system is going to connect. But if I walk in and be very, very calm and model that behavior, and through mirroring, we're gonna create some of that, because mirroring is a technique where I'll actually mirror what you're doing, right, to create that connection. But then I'm going to modify it and I'm going to do something that I want, such as taking the deep breath and relaxing, and then you're naturally going to mirror what I do. So there's lots of ways we can key into this and de-stress and de-trigger. Let's shift gears a little bit. And I'm going to introduce you to the 7 muscles model that we use for identifying resilience. Now, if you scroll down on our workspace, it's kind of lower down. It's not appearing yet. There should be some support materials for you. You're going to see a workbook as well as a self-assessment guide. I'm going to encourage you to download those. Those are PDFs. You can click on them. You can page through them right on the workspace, or you can download them. And within that, you'll see the 7 muscles model. And I'm going to encourage you that as we're going through this model, so they're in our resources section. So Dinesh is just letting me know that they're there. So look for them. As we go through this model, I'm going to encourage you to do a little bit of a self-reflection exercise. Now, there is a self-assessment there. It's a kind of a document that'll help walk you through that. If you just grab a piece of paper, you can just, make some notes. I'm going to introduce you to the 7 muscles. And as we go through each one, I'd like you to give yourself a little bit of a rating of how you think you are relative to other folks. Do you have, this muscle higher developed or lower developed than kind of other folks? But while you think that, put this in the context of a disruption. So this isn't your everyday. This is when the wheels have come off the cart. This is when, the office is now locked down. This is when, your car is broken down, you're stuck on the side of the road. This is when something is happening that is not in line with your expectation. Okay, so let's walk through these 7 muscles, and then we're going to finish up with a little talk around what we can do going forward and how we can actually do some good targeted exercise to build those muscles, if you will. Okay, so the first muscle is positivity. And positivity is your outlook on the world. So this is you looking out on the world and saying, the world is a big, dark, scary place full of danger and risk. Or the world is a big, bright, beautifully colorful place with lots of opportunity, and there is hope within those challenging situations. When the pandemic first hit, my thought was, okay, this is going to be tough and difficult, absolutely. But there's a big opportunity here because we're now going to step into a virtual world, and we've been trying, and I say we in the learning and development space, we've been trying for years to gain acceptance of what we can do in a virtual space in terms of training and conferences and things like that. So there was hope in that challenge. Now, positivity is not about being all sunshine and rainbows. We need to have balance here. So you can have too much positivity. And this is, I think, best articulated in the Stockdale paradox. Admiral Stockdale, he was a U.S. Navy admiral who spent, I think it was 7 years in a prisoner of war camp in Vietnam. And something he observed is the people who came in that were super positive and super hopeful, they're the ones who did not last. The ones who came in with no hope also did not last. It was the folks who had the positivity, but they were balancing that with the reality of the situation. And he framed it this way, which I thought was brilliant. People would come into the prison and they'd be like, oh, we'll be out by Christmas. Christmas came and went. Oh, we'll be out by, Thanksgiving. Thanksgiving came and went. Oh, we'll be out by Christmas. And it wore them down. So we need to have this balanced with our the reality of the situation. But if we're constantly looking at the world as it's all risk and all danger, that's going to wear us down as well. So we need to find kind of that nice place. While positivity is our outlook, confidence is our inlook. So positivity is my outlook on the world. So as I look out through my window here, is it a great place? Is there wonderful opportunities there? Confidence, I now need to look inwards and ask myself, do I have the capabilities to be successful, to deal with these challenges? Do I have what it takes? Again, too much, we're into bravado. Not enough, I'm not going to step up to the challenge. So we want to build our confidence, and we want to make sure that we feel comfortable and confident in our own skin to step into that situation and to successfully deal with those challenges. And again, over time, through practice, we can build those out. Priorities. And full disclosure, folks, this is my kryptonite. This is the one that I find challenging. Priorities is all about identifying and paying attention to the things that matter the most. Now, someone with low priorities, they'll be scattered. They'll be, just doing everything and everything. They'll have a lot of difficulty saying no. And what happens is they end up stretching their resources so thin that they lose some of that effectiveness, that they're not able to actually, do what they need to get done. Too high a priority, and you get, the blinders and the blinkers. So we want to identify what are the most important things to us and making sure we pay attention to those and making sure that we're getting the right things done. Because if we spread ourselves too thin, we get distracted and we're not actually tackling what's important. And a key skill here is to say no without guilt. And this is something that I struggle with, because I find that it's very difficult to, say no. So when I get requests like Sam saying, hey, would you come speak at my conference? My knee jerk is yes, absolutely. And I've learned over the years that every time I say yes to one thing is a no to another. And when I say no to something is a yes to something else. So through time and deliberate practice, I've been able to build up this muscle and leverage it. So we all have them. It's just a question of where we find our most comfort. Creativity. Oh, now creativity is where I'm a rock star. This is my superpower. Creativity is all about generating a wide range of possibilities and options. It's all about being okay with ambiguity. When the pandemic first hit, some people were overwhelmed by the sense of unknown. Some people were, what are we going to do? And how do we do this? And I don't know. And I just can't take that first step. And I'm just going to be so overwhelmed. While others are like, okay, let's go. It's, there's a bunch of unknowns here. We'll step into it. We'll figure it out as we go. Let's head down the path. So creativity is about generating new and different ideas and options and being, coming up with ideas that didn't exist before. But importantly, it's also about being okay with ambiguity. Now, I want to share with you a story. It's kind of a funny one. There's a colleague of mine who, and I never did get to do the formal resilience assessment with her, but I would say she probably scored fairly low in creativity. Very, very structured person, very successful, worked in a very structured way, but, always had all the answers, researched the heck out of everything, and just a phenomenal person to work with. And we're at the company Christmas party and we're leaving the party. And she says to me, I need your help. Which way do I go? Because, we're all getting in our cars to drive home. And she says, which way do I go? I'm like, well, I'm not really sure. Now, I had organized the party. I'd chosen the restaurant. And I was like, well, first of all, I don't know where you live. And I said to her, but don't you have a GPS? And she said, yeah. I said, well, follow the GPS. She says, no, I need to know which way to turn as I leave the parking lot. And what occurred to me on that moment, her level of ambiguity was so acute. She did not like the ambiguity. Making that first turn, she needed to have that data. Now, for me, I'm like, I'll turn, I'll just go. And then if it's the wrong direction, the GPS will just, recalculate and it'll tell me to turn around and go the other way. And, so I go around the block, who cares, right? But I'm someone who's okay with that. And there are people who are not. And one of the things we want to think about for ourselves is, are we okay with that level of ambiguity? And if we are, fantastic. Perhaps it's priorities or positivity that we need to work on. Or perhaps I'm not okay with the ambiguity. Well, there's something that I can work on. And we'll talk about how to work on that in a moment. Connection. Now, connection is all about relationships. It's about literally connecting with others. So building the relationships with others, but very importantly, drawing on them for support. There are lots of people who build tons and tons of relationships, but never activate them for support. So they'd be scoring lower on the connection scale. And of course, if I'm not building the relationships, it is okay to ask for support. And this is where, as I was listening to Amy and Alison talk just before my session, when they talked about the 58% burnout, and no one ever asked, how are you doing? And how important that was to that person. This is that sense of connection. This is that sense of relationship, and that sense of, I need to have my support network to be able to call on. And there are some people who are very, very good at this, and this is their default. There was an old boss of mine. This was his go-to. If he had a problem, first thing he would do is pick up the phone and call for help, right? And it's about kind of finding that balance, because there are times when it is appropriate to call for help and it is absolutely the right thing to do. The question now becomes is, have you developed that muscle so that you're comfortable in doing it? Let's think about putting our coat on, right? If I need to put my coat on in a different way than I normally do, how comfortable is that? And the way to get comfortable with that is to actually experience it, to practice it, to do those things. This is why we practice a musical instrument, right? We practice over and over again. It helps build out those neural pathways. And then it becomes more comfortable. Structure. Now, structure is all about creating and applying effective systems, plans, processes. So if you're the type of person that when faced with a disruption, the first thing you do is you fire up Excel and you start creating a table of data. What data do we have? What data don't we have? Let's sort that data. Let's organize that data. Let's figure out where we're going to get that data, and so on. This is all structure. And again, we want to have our muscles in balance so that we use the right muscles at the right time, and we also have them available to us at all times. So structure, the other thing with structure, by the way, is that you externalize that. So if so I make lists in my head, I think things through in my head, but sometimes I don't, necessarily communicate it out. So when you share out that structure, that's actually a part of it as well. And then finally, experimenting. And experimenting is all about giving it a try. This is about taking the leap. This is trying something new and different. And this is an interesting one of the 7, because this one is really tied to all 6 of the others. Because when I decide to experiment, I'm going to give that a try. The question now becomes, okay, I'm going to step into the challenge, but how do I step into the challenge? Do I phone a friend? Do I create a list? Do I, brainstorm some new and creative ideas? Do I say, you know what, I got this, and I can just, go forward and, use my own competence to take care of it, and, kind of do a bit of a solo act. Now, as we look through these muscles, you think about how they are in opposition to each other. Much like your bicep and your tricep, they work together. So if we don't have one, we could extend our arm, but we couldn't curl it back in, for example. So we think about how some of these are in opposition to each other. Where I have positivity, the world is a great and wonderful place. I also have that reality of priorities. I need to focus in on these details. Where I have creativity, I can come up with all new and different ideas. Again, I also have, priorities to help focus that energy and time down. Where I have confidence, my own inner confidence that I can take care of this and I can step forward, I balance that out with connectivity, with the whole, reaching out for help when I need it. So when you have too much of one and not enough of the other, we can get out of balance. So this question's a little bit loaded. What is your superpower? And let's, so Dinesh, if you want to just take down the collage for the moment, we'll go back to the regular chat. And I'm going to ask that within the regular chat, as you feel comfortable, share what is your superpower. Is it positivity? Is it connection? Is it creativity? What is the one that is really your go-to? And this is a bit of a self-discovery exercise so that you can think about what is your superpower. Now, likely, and this is why it's a bit of a loaded question here, folks, likely you are overusing this muscle. So creativity was my superpower, right? And creativity was the one that I would always go to. That coupled with experimenting, those were my 2 highest scores in the assessment. I would tend to volunteer. I would tend to step in and jump into it. And by the way, I've got 7 great ideas of how we're going to do this. Now, let's couple that with a low score in priorities. Okay. So now I was getting too scattered and too thin, and I'm going in 5 different directions. And yeah, so when I first got into this resilience work, it was a huge aha for me to realize and recognize that these scores, they all work in combination with each other. And there were some days I was a rock star, and there was other days I was falling flat because I'd overdeveloped some muscles and underdeveloped others. So while the muscle was there, it wasn't really fit, and it wasn't really, giving me what I needed. So think about, what is your superpower? And if you feel comfortable, share it in your chat. I'm seeing a number of them here. I love it. Susan, structure. Yep, absolutely. I can see that, Susan. It's, you're pulling out the spreadsheets, you're pulling out the lists. Love it. Yep. Emily, connection. So Emily's the one phoning a friend right away. Love it. Naomi. There's a kindred spirit here, creativity, right? Just coming up with those ideas and brainstorming. Sam, mine is positivity. I see challenges as opportunities. Absolutely. So looking at that, that world is just a great place. And you know what? That challenge is, yeah, let's go do this. This is going to be awesome and great and wonderful, right? But what's interesting is we're seeing different responses by different people, right? We're seeing, this is mine. And as we learn that about ourselves, we can recognize where, being creative might not be the right approach, being, super positive might not be the right approach for this person. So someone like Susan, for example, with high structure. Susan, you're actually one of my best friends, by the way. I say that because I recognize that structure. So while priorities was one of them, structure is the other one. I always struggle with that. Getting down into the details, it's not my gig. But when I get people like Susan on my team, what happens is we start to balance each other, right? So I seek out the Susans in the world to help me become more balanced. And this is one of our strategies. When we identify what our own superpower is, then we look for things in our teammates and the people that we work with. So as I pay attention, I'm going to see that Emily is very connected, and she likes to, reach out and have that network and sort of, see those different things. I'm going to see that Sam and Mary and Tiffany are all very positive, and they've got that high level of optimism, and they're going down those paths, right? And I see Susan with the structure. So I'm going to turn to the appropriate people at the appropriate times to say, can you help me with this? Because at this point, here's what we need. We need some structure because, this is so ambiguous and there's no structure here. And really at the beginning of COVID, we needed a lot of that. We needed some of that structure. We needed some of that positivity and optimism. But you know what, this is going to be okay. We're going to figure this out. Yeah, it's a challenge, but there's opportunities within here. We also needed some of that connection as we reached out to our network and said, you know what, let's check in. Let's see how we're all doing. And there's a whole other level of brain science that comes in when we start doing, things like that, the dopamine, oxytocin, serotonin, getting released and helping us feel better. And I'm sure many of us did this. I know I did, especially in the early days and, the early months of the pandemic. We were reaching out to our networks and just doing check-ins and saying, hey, how you guys doing? And that felt good, right? And that was an important time to leverage that connection muscle. So we think about the different ones that are there. Again, you've got the self-assessment in the resources down below. There's actually a booklet in there as well. And on that booklet, it actually talks about how to develop the various muscles. So I want to finish here with that part. And I'm going to invite you to do an I commit to statement. And we'll talk a little bit about what that is. When you've identified which muscle you want to work on, I recommend you do micro challenges. And here's what I'm talking about. A micro challenge is a small challenge. So let's say you have a high aversion to ambiguity, right? So you've got a low score in creativity and you want to build up your creativity muscle. You want to be okay with the ambiguous. Give yourself little micro challenges. Now, I mentioned that this was my high score. So here's how this manifests in my life. I will go into a restaurant for, dinner, lunch, that kind of thing. And I will look at the wait staff and say, bring me food. And they're like, what do you want? I was like, don't know, don't care. Bring me food. Well, do you feel like chicken or beef? It's like, don't tell me, just bring it. Right. And I don't do this every time, but I do this once in a while. And, people look at me and go, you're crazy. It's like, well, no, because you're going to eat again in about, 4 to 6 hours. But let's say you're someone who's not good with ambiguity, right? You've got a low creativity score. Here's how you might approach a restaurant. You're going to look them up online. You're going to read the menu ahead of time. You're going to pre-select. You're going to find out what the daily specials are. And you're going to walk into that restaurant already knowing exactly what you're going to order. Right? So here's my invitation for you if you're in that situation. I want you to find a trusted friend, someone that you enjoy going to dinner with. Go to dinner with them. Let them choose for you. Now, here's the reason. They are a trusted friend, so they're not going to take you, and get something that's completely outside of your comfort zone. Do something that is a little bit outside your comfort zone and practice it so you can, exercise that muscle and get comfortable with it. And then you can work on something a little bit bigger. So if you have a low thing with connectivity, for example, like you don't like to reach out and ask for help, how about if you do it on a small thing? With someone, again, a trusted resource, a close ally, someone who you feel comfortable in asking for that support from. And keep in mind that while you don't want to be a burden, and I've asked this, and I'll ask this of you, do you enjoy helping other people? Now, we're kind of in the industry of helping other people. And many of us come to this industry because we enjoy helping other people. But I've asked this question of hundreds of people over the years in all different industries. And I've yet to have anyone come back and say, no, I don't like helping other people. Almost universally, people love helping. And it's like, okay, why are you denying that joy of someone else? Because when I come and ask you for help, I'm actually giving you some great joy as you want to help others. And so we want to reframe things and start to think about how we can, do these micro challenges. Now, in the materials that you'll see in the resources page, there's 7 pages in there, one for each of the 7 muscles. And at the bottom of each of those pages, they have a little micro challenge. Things like having someone else order for you at the restaurant. Things like, asking for assistance on something small from someone that you're very close to before you, do the big ask from someone who's not as close. And, reaching out kind of in those terms. So think about what you're going to do. And I'm going to invite you to complete the I commit to statement. If you feel comfortable doing it in a public forum, I invite you to do it here. I mean, it's not quite public because it's a closed group, but the more that you do a public declaration, the more likely you are to follow through. So I commit to, and then finish that statement, whatever that is. The key here is the word I, because it is all about you. It is all about your self-development. And we are now asking that question, how are you doing? We want you to do better. You've got some wonderful support mechanisms there if you need to reach out for help. Hopefully this will help you with some of that development. I just see Naomi popped in at Christmas time last year due to COVID. I brought a number of items needed. I phoned family and friends, informed them that I bought them. An item I needed for dollars as a gift for you. Now buy yourself something worth the same as a gift from me. Oh, I love that. That's an awesome idea. So you bought gifts for yourself and then you told people how much and invited them to buy a gift for themselves from you. They love the idea and are now doing it. That's a lovely creative idea, Naomi. Thank you for sharing that. And Sam's already popped in her commit to statement, of course. So I want to thank you all for your time and energy today. It's a topic that's very near and dear to my heart. We're just scratching the surface here. Take a look at those support materials. I've included my contact information if you want to reach out to have a bit of a deeper conversation around that. So thanks for your time. And I think, Sam, you wanted to probably finish up with a couple of quick questions.
Thank you, first of all, very much. David done a TEDx talk on the topic as well, which is great, and that's how we connected about this topic. And I know that my weakness is definitely reaching out for help. I'm happy to reach out to try to arrange an event or something like that, but saying I need help with this is a hard one for me. So I'll try to work on that over time. Building off of that. So family councils are made up of people from all walks of life, experiences, personalities. So how can councils, these groups of people, better understand members' resilient skills to support a healthy group dynamic? That you don't really have a lot of control necessarily of who's working with you, but how can you do this better as a group?
Yeah. So the first thing to do is look for those signs that say, and I'm going to use you as the example here because you openly declared it, and totally see that in you, by the way, Sam, is that level of independence, that level of, I got this, right? Mm-hmm. So as I'm working with Sam and I recognize that in her and I'm seeing her struggle, even just something as simple as, do you need a hand, right? To make that offer. You might be working with someone who doesn't have the self-awareness. You may be working with someone who, they've got a bit of a skewed view here and they're not willing or able to take that first step. So let's be the bigger person. Let's give them the opportunity. And I think it was Gandhi who says one of the best things you can do is give your enemies a graceful exit. We've all gone down that path where we've said too much, we've gone too far, we know we're wrong, and now we can't go back, right? Let's give them the exit. Let's invite them to that place where they need to go. So I'm working with Sam on this conference. She's loading herself up, taking on everything like she usually does, and it's like, Sam, let me take care of that for you, right? And it can be something as simple as that. And then as the relationship develops, and depending upon the relationship, I may actually come to you at some point and say, hey, Sam, can I chat with you for a sec? You're really taking the lion's share here, and I see that you're struggling, and it's actually, from what I see, is negatively impacting your work. Is that what you're seeing? And then, ask that person for some of that self-reflection. This has the added benefit that it also helps with some of that de-triggering that we talked about earlier, because I'm actually asking for Sam to access some of that higher level function. I'm asking for some reflection, some cognitive recall, as well as some processing of it. It's like, yeah, okay. Yeah, I'm seeing where you're going, Dave, and I understand that. But it's okay. I got it. So, you know what, Sam, you've got a team here. Let's work together. I'd really love to, find some of that balance, work life, et cetera, et cetera. And we go down and have some of that conversation. And then I'm going to, be the brave one to say, I'm going to broach that and I'm going to bring it up, as opposed to stepping away from it. Because as humans, we all want to get along. And it sometimes can be very, very challenging to step into the tension. But, we need to. And I don't know about you, but any of the times that I've had to do that, while it's scary in the moment, it usually works out better in the end.
Yeah, I believe that. I'm lucky that I do have a good team who will call me on that and be like, I've looked at your calendar. Maybe we should have a little chat about this. Just saying. And a couple of people on my team are probably writing down exactly what you just said, so that next week we have this conversation. Building on what you said about using, so it's like seeing this as a gift and being able to help others by reaching out and helping them through this. And you're going to see a cat tail go across the screen. She's also attending the conference. How can the folks in attendance today take this back to their communities, their groups, and help their peers? So help staff, help families and residents discover their superpowers and build their weaker muscles.
The first place would be share the model with them. Feel free to duplicate and share out those materials that we're providing below. There's a community of practitioners out there who are doing this type of work that I work with, and literally worldwide. We've got it in multiple countries, multiple languages. There is a formal assessment you can do. And basically, if you buy that, you fill in this 20-minute-ish questionnaire online, and it produces a report. And then we sit down and have a conversation around what it means and help you understand that and build out an action plan. For some people, they prefer that sort of more formal, in-depth. Others, you give me the higher level model, I'll create my own awareness and think through it. If you're working with a team, first of all, just the simple acknowledgement that we are all different, that we all have resilience, and that we all have different forms of it. So that, for me especially, and I've heard this from many of my practitioner colleagues, is a huge epiphany that resilience isn't just a single, simple, binary, you have it or you don't. We all have resilience. We have it in different ways, and different situations call for different things. So when we stepped into the pandemic, huge amounts of ambiguity, like off the charts when it came about ambiguity, right? We'd never been down this path within our lifetimes. So things like creativity and being okay with ambiguity, but also we needed to have some of that structure, right? To okay, let's respond here, but let's not just kind of respond in a, off the cuff kind of way. And the further it dragged on, the more important that structure became. So when you have the short-term acute disruption, the snowstorm, having a little bit of that high creativity without the larger structure is actually pretty good. But when you get into the longer one, we need to kind of shift how we're approaching it. So pay attention to how people respond, right? So you've got 7 people sitting around the table, and something hits, and one person says, this is going to be, I see opportunities here. Yeah, I know this is going to be a big hassle, but it's going to help us do this. It's going to help us go in that direction. There's positivity, right? Someone's sitting there going, I got this. No problem. Bring it on, right? There's high confidence, right? Hey, I've got some creative ideas of how we can do this. There's the creativity. You know what? I think we should bring Sam and Bill and Joe and Dinesh and let's bring the team together. There's connection, right? Let's make a list, right? There's structure, right? So we've got different ways of approaching it. And if you just simply pay attention, and you'll notice that when these things happen, Dinesh is the one who's usually writing the lists and structuring the data, right? While Dave is off, as a flights of fancy coming up with all these creative ideas. Great. We need creative ideas. Let's call Dave. We need structure. Let's call Dinesh, right? So then it becomes, now you can start to actually enhance your own personal resilience by leveraging your team, which of course is connection.
Absolutely. That's fantastic. I definitely think that the folks who have been with us throughout this session and who will be watching the recording in the future definitely benefited from a deeper understanding of the science behind resilience, and then also really taking a look at what's our strengths and where are our opportunities for improvement, or where do we need to supplement with the other people in our lives. So thank you very much, Dave. Always a pleasure.
You too.
We always have a good time together. But for those of you with us, check out the resources Dave has made available to us, share them widely. This is something we're going to continue to have conversations on. One of the beautiful parts of House Space is that we can do that post-conference to have learning communities and opportunities for engagement. So this is a good launching point for more collaboration and connection in the future. But Dave, once again, thank you very much for your time with us this afternoon.
It's a pleasure as always. Thanks.
Thank you. We are now going to be moving on to the next part of our agenda. It's an exciting thing that I'm happy to introduce. It is from our backing it up. We've had the opportunity to work with different students from different post-secondary institutions over the years. And it is this term, I think we have 6 or 7 folks, different folks with us that my team has been working with. And so we are next presenting, as part of some skill building, the field placement students' thesis presentations on different long-term care topics they've been working on. So this is a video of from our various students that I am very excited to share with you. So after this, though, we're going to be going into some networking. So if you have questions about what the students are working on, want to talk to them more about it, we'll be having that opportunity right after the video closes. To do that, you're just going to go to the networking tab on your House Space, and we'll be joining some different rooms just as an opportunity to chat before we have our final closing keynote at 4:45. So Dinesh, I'll leave it to you to close to queue up the video, and then I'll do the wrap up after that, and we'll go into some networking.
Good afternoon. My name is Kathleen Edwards, and my pronouns are she and her. I'm the Education Manager for Family Councils Ontario, and it is my pleasure to introduce this session, which is the Family Council Ontario Placement Student Spotlight Stakeholder Feedback Session. As I mentioned yesterday, we are truly blessed to have some placement students working with us this fall and winter. Today, you're going to have a chance to get to meet them, hear a little bit about their background, as well as the work that they've been doing so far as part of their placement experience with Family Councils Ontario. I've also challenged each student to ask a specific question. And this is a question tied to their work where they would really like to hear from you as Family Council members, stakeholders, and individuals who are knowledgeable about the long-term care sector. So there's two ways that you can participate in this session. One, you can type your response or your answer to their question within the chat during this session. The other option is that at the end of the session, I'll share my email and you can share your response to their question with me through email and I will pass it on to the students. Thank you so much for taking the time to hear what the students have to share, as well as for providing your feedback and your insight to help inform their work. So without further ado, let's get to know some of the students. Sit back, relax, and enjoy.
My name is Emily Ray. My pronouns are she, her. I am a Trent University student at the Oshawa campus. I am a fourth-year placement student at Family Councils Ontario. My interests include gerontology, social work, mental health, and empowerment. And I'm currently in the Bachelor's of Social Work program. So some of the projects that I have this semester and next semester with Family Councils of Ontario is the creation of resources that promote inclusivity with long-term care facilities and within family councils. So on the right side of your screen, you'll see a example infographic that I've been creating that really explains the LGBTQ2S plus community. And it's a guide to pronouns and sexuality. So there's a list of the different words that have come up recently in the terminology of the LGBTQ2S plus community. The rationale for this is to create awareness, to educate, to create safety, and to build relationships. And this resource creation can be used for families, residents, and long-term care staff. Another project that's a little bit more involved is a focus on social justice and long-term care. So an example of this that I am doing is creating an outline for Family Councils Ontario, creating a long-term care strategy. So basically I'm looking at legislature, old legislature versus the new ones that will be coming out, and comparing the two and seeing from a social work lens what is left out, what is included, the language that's used, and trying to understand whether or not it is friendly and whether or not it does promote social justice, and whether or not it's from an anti-oppressive perspective. So the rationale for this is creating empowerment, self-advocacy, how to properly navigate systems, recognize oppression, and learn how to negotiate within the legislature. And so like social workers, families of those in long-term care and family councils are working to advocate for someone else. And this can be very, very taxing on families. And so what I would like to know about you is, what do you need as a caretaker, as somebody who is looking after someone else and who has been advocating? You know, do you need someone to listen, to empathize with what you're feeling? Do you need resources to cope with stress? And do you need to learn more about self-care? Because again, when you're advocating and when you are representing your loved ones, you know, your focus may be on the loved one, and you need that self-care, and you need somebody to, you need that time to listen and that time to have for yourself so you can be a better person for your loved one. It's important to recognize that we as advocates need some care too. Being an advocate can certainly be emotionally draining, and I think I would just like to know, you know, what do you personally need so that you can be a better person for your loved one?
Hello, everyone. I'm super excited to take part in the conferences this week and to virtually meet everyone. My name is Danny Rusianos, and I use he, him pronouns. I am a third-year social work student at X University, formerly known as Ryerson, and I am completing my placement at Family Councils Ontario. I've taken part in different projects at FCO, including creating resources on topics like the deprescribing movement, being more aware of your social location, the rights residents, families, and staff have in long-term care homes, engaging in discussions surrounding long-term care policy, what is long-term care policy, and conflict navigation in long-term care homes. I've also written a variety of different blog posts on topics such as intersectionality, National Day for Truth and Reconciliation, coping through COVID-19, supporting vulnerable populations, the role social workers play in long-term care, using person-centered language, and what has shaped my personal and professional interests. Currently, I'm creating a spotlight and doing research on long-term care policy. I'm analyzing different reports related to long-term care policy and seeing what may be lacking and what should be added in order to enhance the quality of life among long-term care homes across the province. All of these projects have helped me enhance the knowledge that I have relating to long-term care homes in Ontario, and I'm extremely grateful for that. After being with FCO for about a month and a half, I'm curious to know what families and family councils want to know more about relating to long-term care policy. Policies surrounding long-term care span a wide variety of topics, and it can be hard to keep up with all these policies, especially since they are constantly changing. My question to families and family councils is, are there specific policies you feel should have a main focus on that don't already? Thank you all so much. I hope you enjoy the different conferences throughout the week.
Hi everyone, my name is Fabiha and I am an undergraduate student at X University, formerly known as Ryerson. I'm completing my degree in social work with a minor in economics and psychology. And I'm interested in policy analysis and how kind of principles of economics and social justice and anti-oppression framework, they intersect in real life. So that's a little bit about me and what I'm interested in. And as for my role in FCO, I am a placement student here for the fall and winter of 2021 and 2022. And it has been an amazing experience so far because it has given me the opportunity to interact with service users in practice in the field and to translate everything that I've learned in school, whether it's all the theories and the frameworks and the principles, and to see how it kind of interacts in the real world and how it can be implemented while working with service users and advocating for them in real life scenarios. Especially pertaining to the long-term care sector in the wake of COVID, it has been a huge learning experience for me to first of all learn what a family council is. I wasn't aware that something like this existed, and by attending meetings, I've gotten to meet with and kind of chat with a lot of family council members and caregivers and gain firsthand knowledge on the ground reality of caring for a loved one in long-term care centers and all the struggles that it involves. And that's why I think such a community like this where we come together and support each other is so essential, because it really it helps with advocating for our loved ones in the long-term care centers and also keeping each other kind of happy and the spread of knowledge as well. So I just want to thank FCO and everyone here for allowing me to be here. And I wanted to also talk about the things that I've been working on in my time here. My areas of focus have been to firstly conduct research on the ins and outs of FCO and writing weekly blog posts which talk about basically any topics or any news items that concern the family councils or the long-term care sector in general in Ontario, attending meetings with councils and caregivers, and finally creating a master resource document that compiles information on all culturally specific long-term care centers in Ontario, mostly in the Greater Toronto Area region. And this was important to me because there exists such a huge gap in the system when it comes to the number of ethno-specific and culturally specific homes, and what if the ones that are there, there's a huge, enormously long wait time, which can go upwards of 10 years for people to be placed in the home of their choice. And I think it's a shame that because huge parts of the population and their needs are not being accommodated, and depriving our loved ones of their culture really results in reduced care and quality of life in the centers. So my supervisors and I thought that it would be good to kind of create a centralized list containing all the ethno-specific, culturally specific, and religious focused homes that do exist in the area, because there's also not a centralized kind of a master list on any government websites or anything. So we wanted to make a resource document, also in an accessible, updated way through the use of posters and flyers, which we hope is only the beginning of more work that needs to be done in the field as well. So my question to the attendees here is that through the meetings and the workshops that I have attended in my time in FCO, one thing that has really stood out to me is the resilience and the tenacity of family council members and caregivers that exists. And my question is, how do you guys avoid burnout? And because it can be so difficult to kind of keep going in the face of such adversities that we have seen in recent times. So what are your tips? I think that could help out a lot of people here as well, and myself included. So yeah, thank you so much once again, and hope you have a great day and enjoy today's events. Thank you.
Hi, my name is Mary. I'm a distance delivery student from the University of Manitoba. I am completing Bachelor of Social Work. I am hoping to graduate this upcoming spring, 2022. I am currently completing a student placement at Family Councils Ontario under the supervision of Kathleen Edwards, the education manager. And my focus is currently on mental health of the caregivers that provide support to their loved ones in long-term care or any other facilities. I have been doing a lot of research on different projects, a lot of education, which I've thoroughly enjoyed and have learned a lot. I haven't had much experience in long-term care facilities except for my grandmother, so it's been a great opportunity to learn. I am currently completing several projects. The one that I'm currently doing ongoing is blogs. I have completed blogs about person-centered care regarding language and delivery and introduction to placement, and just kind of catching my bearings to the placement. My placement is ongoing. It's a longer term placement and will be completed hopefully in April of next spring. Some other projects I have ongoing is I have been completing a resource list for mental health for caregivers. I have been learning about the resources available in the province, online, all the virtual resources, and have been creating an ongoing list. I have been completing an information page regarding the self-care for family caregivers, tips on how to take care of themselves so they're in a good place so they can take care of their loved ones that are in the long-term care facilities. I've also been doing a bit of work onto the mental health of the residents in long-term care facilities, how to get them into the best place that they can be mentally. Isolation is a concern in long-term care, and I've included some tips on how to feel more connected to their community and to their loved ones. During this time of COVID, it's obviously been a very big challenge because there's been some major isolation between family members and their loved ones due to visitors restrictions in the beginning, which are easing as we go along. Another project that I will be working on is the legal rights of residents and families and staff, which I think is important during this time of COVID, especially visitation. What are the rights of the families for visiting their loved ones at this time? What are the rights of the residents of the long-term care, connecting with other people, etc. So far I have thoroughly enjoyed my placement. Family Councils Ontario has been very welcoming and accommodating, and I've enjoyed it. I've enjoyed too, especially all the webinars. Last week, I watched a webinar on reflections rooms, which was amazing, which I thoroughly enjoyed. I had never heard of it before, and I really enjoyed it. So a reflection room provides an opportunity for a resident or a long-term care resident or their family member to go into and to reflect possibly on the loss of a loved one, to take the time to reflect and just to process it. The question that I do have is, what do you as a family member wish you had known before your loved one moved into the long-term care? Having said that, as a family member of a past resident of a long-term care, I was very surprised about the rigid schedule and the lack of flexibility. I know my grandma, she took a bath on these certain days at these certain times, whether or not she was feeling well or up to it. And if she happened to decline her bath for that day, it wasn't rescheduled. There was absolutely no flexibility, same as her eating schedule, the time that she got up and the time she went to bed, everything was just so strict. And the lack of flexibility was really a surprise to me. So just wondering what people had wished they had known before their loved one had been placed into a long-term care facility. And that's it. Thank you so much.
Hello everyone, my name is Nicole Catavita and my pronouns are she, her. I am a fourth year social work student at X University, formerly known as Ryerson, and I am currently completing my placement with Family Councils of Ontario. So as someone who was raised by my grandparents, I've always been passionate about aging-related issues, as well as the policy gaps concerning long-term care, home care, and other senior services within the healthcare continuum. So far in my placement with FCO, I have set out to explore the diversity of aging through an intersectional lens, which refers to how socially constructed identities such as race, language, ethnicity, gender identity, immigration status, and sexuality all shape experiences with aging, and more specifically, experiences navigating long-term care. It's arguable that dominant discourses within policy and mainstream practices continue to view and treat older adults as one homogeneous group with a prescribed set of needs, which I'm sure we all know is not the case. In placing residents and their lived experiences into single categories, racial and health inequities are reproduced, individual needs are forgotten, and power imbalances go unquestioned. So while Canada is aging at a rapid rate, the older adult population is increasingly becoming more diverse, with visible minority seniors among the fastest growing segments of the population. These changing demographics are intertwined with each other, which of course creates a lot of pressure on the long-term care and home care sectors. Much like how these challenges intersect, systems of oppression such as racism, sexism, ableism, and ageism are all interlocked, layering with each other and impacting residents' experiences with care and needs in long-term care. That being said, there's currently a high demand for cultural-specific care of residents. An Ontario-based study found that being an immigrant and applying to an ethno-specific home was correlated with longer wait times for placement in long-term care, in comparison to the wait times experienced by Canadian residents. Some residents in cultural-specific homes even waited an average of 7 to 8 years for accommodation. So it's safe to say that not everyone has the privilege of accessing or entering a cultural-specific home. This has led to many older adults entering homes where no one speaks their mother tongue or understands their culture, which can hardly feel like home. The COVID-19 Long-Term Care Commission reported that over the course of its investigation, it was found that long-term care homes lacked recognition or acknowledgement of the diversity of its residents. This resulted in residents experiencing feelings of isolation and alienation, which were only exacerbated during the pandemic when family members and caregivers were not there to bridge cultural and linguistic gaps. So, the work and research that I've done so far truly illuminates the power of lived experiences, which I believe to hold so much knowledge. So, I'm turning to you all and asking, do you feel that your long-term care home values and recognizes the diversity of all residents? If so, what are the ways in which you feel cultural diversity is supported? And if not, what steps do you think should be taken in order to meet these diverse needs? Thank you.
Thank you so much for taking the time to join us for this session today. The students and I truly appreciate any of the comments and insight and thoughts that you shared with them. If you felt that you had more you wanted to add to the conversation, or if you're listening to this presentation after the conference session has happened, please feel free to share additional thoughts and insights you have with me to the students' questions via email. So please share your thoughts and answers to the questions posed by the students to me, Kathleen Edwards, and send it to me via email. So my email is cedwards@fco.ngo, and I'll make sure that I pass it along to the students. Again, thank you so much for your enthusiastic participation and for all of the insight and ideas that you shared with the students. They will definitely take this to heart and add it to the work to make sure that the resources that they're creating will really work to address your specific needs and interests and help to support and further the agenda of all the family councils working so hard within the province of Ontario. Thank you so much, and I hope you enjoy the rest of the conference.
Thank you so much to Kathleen and all of the students who participated in that video, and also for all of the work that they've been doing really just since September, which seems both not very long ago, but also a long time ago. So thank you very much to them. It's so great to hear new perspectives and new voices, and to encourage, and for FCO to be able to encourage folks to explore long-term care and the wide range of opportunities to get involved, perhaps as a career choice for the future. Now we want to have some discussions about what you heard from the students and to provide your feedback to the questions that they've posed. What we're going to do now is we're going to go to the networking tab, and we're going to go to Room 1 Agora. So go to the networking tab, which is on the top of your screen. You'll see Room 1 Agora. Posted just under that, there's what looks like the beginning of a slide deck. If you click on that, you can download it. And what it has is the questions that have been posed to you from the students. So I navigate there, click on it, download the file, then join Room 1 Agora, where Kathleen and the students are there to discuss the questions they've posed and for you to ask them more about their work. So we'll join you there over in Room 1 Agora on the networking tab. See you there in a minute.
Oh. Hi. Wow. Video sharing.
Welcome back, everyone. I hope you enjoyed the networking opportunity in the Agora room to meet with our students and exchange your ideas, the answers to their questions. It is now the penultimate part of our day together, our 3 days together. The only thing after this is closing remarks, but I am in this moment so pleased to turn it over to my colleague, Kathleen Edwards, who has organized a fireside chat style panel discussion with 3 excellent folks with incredible lived experience in family council work. So over to you, Kathleen.
Hello, everyone. So you know me quite now by the end of today, but if you're new and just joining us now, my name is Kathleen Edwards. I'm the Education Manager for Family Councils Ontario. I hope that you've enjoyed the last 2 days of our conference and have found some really good insights and information tied to the work for you and your councils. And this session is intended to kind of help wrap everything up and share some experiences from different council members about the work that they're doing to give you some ideas, because it's not just this conference isn't just about attending, it's also about bringing what you've learned and sharing the knowledge and resources with the staff in the home where you work, as well as with the other family council members who may not be able to attend. So that being said, the goal of this session, this fireside chat, really is to help you come away with what are your next steps for how you can take what you've learned and bring it back to your own councils and your own long-term care homes, whether it's through thinking about networking and connecting with other councils locally, whether it's through advocacy, or whether it's through just engagement within the family in your own home. So family engagement, those are some things that are going to happen. So I'm going to welcome our 3 panelists to come on and join me. The first panelist who's going to be joining us is Bob Gadsby. The second panelist is Julian Morelli. And the third panelist is Heather Moxley. And so now that they're here to join me, I'm going to let each one of them introduce themselves a little bit. So we'll start with Bob. Tell us a little bit about who you are and your connection to Family Councils Ontario. You may need to unmute your mic,
My name
Bob.
is Bob Gadsby. I'm chair of Select Extend the Care.
Oh no, Dinesh, he thinks you're having internet challenges, Bob. So we'll come back to you. And
can you hear?
I think you're cutting in and out. I think your internet's being a little choppy. So I don't know why that is, but we'll move on. We'll come back to you, and we'll let Heather introduce herself.
Hi, I'm Heather Moxley. I'm the chair of the Family Council at Pearly Health in Ottawa. I've been associated with the Pearly for 15 years as my father was a resident, and he unfortunately has passed on, but I've stayed with the Family Council and also very active volunteering on site, just so that I can continue the lived experience. It's hard to be part of a council without the day-to-day sort of appreciation and contacts. So thank you for inviting me.
Thank you for joining us. And Julian.
Hi, can you hear me? I guess so, eh? Okay. I'm Julian, and I'm a advocate, I guess I would call it now, for family caregivers. I call them essential family caregivers because they are, and chosen ones if a resident chooses someone outside of the family. Currently, I was involved with the council and my mother-in-law family council in my home until she passed. But I stayed involved working with the provincial government as on the pandemic committee as a advisor, and now with the national standards for long-term care. I sit on those two, and that's a little bit about me.
Thank you. And I feel like Bob might have just gone to get his tech support to check and see why his internet might be a little bit choppy. So we'll get back to Bob. I do want him to introduce himself to you if you haven't already met him. Some of you may know him because I know he's very much involved with the Family Council Network, and which is one of the reasons why I wanted him to speak. So while we're waiting.
Last night, him and I. Might have
While
to
we're
bring
waiting for
him.
him to join us, I guess I'll start by asking. So the first question I want to ask the panelists is, how did you get started with the Family Council? So how did you get involved? So Julian, I'll start with you, and then Heather, I'll come back to you.
Well, I started when my mother-in-law ended up in a long-term care home. And how I got involved is I heard there was a family council, and we needed help. We didn't know what was happening. It was foreign to me. I never thought I would be a caregiver in long-term care, but I was a caregiver for my mom and dad since the time I was 7, 8 years old. As an immigrant family, I was a translator at the beginning, and then I became an advocate for my parents. And they didn't even use the term caregiver back then. We were just part of the family. But I got involved because I found out that the family councils were in law, were in legislation, were in government. It has what they call standing. In other words, it has an official status in government. So when I saw what was happening and what I didn't like, I couldn't believe. So I started to use my skills to help understand the legislation and help out best I could in understanding not only our situation, but others. So I hope that answers your question.
Absolutely. And Heather?
I started attending the family council meetings about 11 years ago when the council was first set up at Pearly Health, and I felt that they were being taken very seriously. There was good collaboration with the management team. So there was good information flowing back and forth and a good bit of respect. So it was worth my while to spend what would otherwise be a really busy evening still at a meeting like that. And then as I retired, it was just a really great time to be able to participate more fully. And I joined the council as the secretary and continued on. So I've been present at council meetings for 10, 11 years. So I've seen a lot go by.
Absolutely, and especially this unprecedented time. We got Bob back. Yay! Tech issues, they always happen at least once every council. So we'll let Bob introduce himself, and then I'll ask the question to him that you both just had the chance to answer. So Bob, take it away.
Hi, my name's Bob Gadsby. I'm chair of the Family Council at Extendicare in Hamilton. I'm also chair of our regional Family Council network. The region is LIN 4. We include 86 long-term care homes, about 11,000 residents. The region is Hamilton, Niagara, Haldeman, and Brant, including the city of Burlington and the county of Norfolk. And I was also one of the charter members of the board of directors for Family Councils of Ontario.
So Bob, both Julian and Heather talked a little bit about how they got started with family councils. So for you, because you also were involved with not just family council, but also starting a family council network, I'm going to ask you two questions. How did you get started with family council? And then how did you get the idea to then start a family council network in LIN 4?
I probably started in a similarly of you. In 2001, my 82-year-old stepmother, who was suffering from dementia, moved into a long-term care home in Hamilton. In 2003, my 90-year-old father joined her. He was in a wheelchair, but mentally alert. She was physically okay, but mentally challenged. In 2004, the social worker at Extendicare Hamilton approached a number of families and asked whether we'd be interested in forming a family council. About 6 families came together, and we studied the Ontario Family Council's program manual. And we, as our first action, decided we should think about a task, and we thought of a survey form of families to provide their input on what was working well, what would you like to learn more about. That started me on the road. They had in mind.
Well, we'll have them back.
My mic is muted too. I think that's the saying of like 2020, 2021. Your mic is muted or you're having internet connections. And I don't know if anyone has coworkers or colleagues that take like screenshots of their face frozen and then makes memes of them. But I worked in a research lab where there are some people that we would do that just to kind of like have a bit of a sense of humor with one another, because you have to have a sense of humor at sometimes. So Bob did mention, a resource that helped him and his family council getting started was at the time the Family Council Program Handbook, which is now, I think, transitioned into the Family Council of Ontario Guide, your guide to starting and maintaining a family council. But Heather, what were some resources that were helpful for your council when they were getting up and started?
Definitely the network of councils in our region. There was the Champlain Region Family Council Network, which has continued to be extremely active. So they came into our first couple of meetings. They coached, they provided just secondary support. It was really quite nice. They talked about how they'd seen different councils work or not work in the region. So that was very, very helpful. And they continue to be a really strong resource for us.
I like that you mentioned the network. So Heather was just saying that she's, even though she's part of her council at Pearly Rideau, when they were getting started, Bob, the Family Network Council in the Champlain region was a really good resource for her council to kind of learn a little bit more about how councils work. So beyond Family Councils Ontario, the local Family Council Network may be able to give you some different ideas about structures or ways that councils work and operate. Bob, how did you get Family Council Network 4 started? Oh no, cut out again. Oh my. All right. I apologize, everybody. So Julian, what were some of the resources that were helpful to you and your council?
Well, I mean, initially when we started, when my wife and I started to reach out. Like I say, I'd worked in government and I'd worked in politics. Don't hold that against me or anything like that, but that's what I did. But what I first did was reach out to Family Council Ontario once I knew you existed, and it was a long time before that, and I used that as a launching pad. I think the first conversation I had was with Sam. She doesn't remember, and then there was one with Tiffany, and then from there I went and had a conversation with the government, policy people. I sent them 2, 3, 4 pages of questions. I think they were surprised at the type of questions because they were more around standing and rights and all of that sort of thing. But then I reached out. I think what's really important is I went beyond Family Council, and to pick up who was out there that I could talk to, who was out there that could give me a different perspective. So I reached out to the Dementia Society in Ottawa because I saw the link between long-term care, and I'm still involved with them. Every 2 or 3 weeks they have a meeting, and I listen in, and I learn lots. I also connected with other orgs like, CARP was another, the National Institute of Aging. You might know Dr. Samir Sina. And I reached out to people like other family councils. I reached out across the province and listened to what the challenges were, what their priorities were. And I did that for a lot of reasons. One of them is I sat on the pandemic committees and still do as on their communication side for Ontario. I wanted to get everybody's perspective. I wanted to know from even the industry standpoint, I wanted to know what their challenges were, because you have to understand the other side, so to speak. Whether you agree or not is at least understand it. And then I just did a lot of reading, and I'm sure Heather's done a lot of reading and a lot of talking with caregivers, always trying to put myself in their position, always. And sometimes it's hard to do. So if I were, that's really what I did. I took a larger approach.
And that's great to hear. So yeah, as you both mentioned, Family Councils Ontario is a great place to start. Give the staff a call, send staff an email if you aren't too sure where to start, or if you have a question and you aren't too sure what resource would be helpful. And as Julian said, being curious and exploring those other organizations. And Julian's going to add to it because he just had another
thing, Heather, and sorry for that, but I also reached out politically and said, "Did you know this? Did you know this is going on?" And I didn't reach out to one party. I reached out to them all. And I reached out to them because I don't, even though I'm political background, this is not, to me anyway, a political issue. This is now a Canadian issue. And all parties, and I'll be frank, bear some responsibility for what's happened over the last 30 years. So, yeah, I think that's important to say. And I said it to all the parties, the same thing. So I was trying to be as open. Sometimes that doesn't work, or people don't believe you, but that's the other resource I use to understand their position.
And it's interesting too. So I know that the networks themselves, so the Champlain network does engage in collective advocacy. But Julian, you also mentioned that you yourself as just an individual family member on your own engaged in advocacy. So I'm wondering if you could speak to that. So what can advocacy look like for councils? Is it something very organized, or is it something more informal, as Julian said, of just making calls or trying to invite someone and building those connections with the local politicians?
I think that's you, Heather.
Oh, was that? Sorry.
Yeah.
We have a little a advocacy concept in our family council, where we take local issues that are systemic to our facility. The big A advocacy, we try to back up and shore up the Champlain region advocacy, because as you said, Grace Welsh, who's the advocacy prime there, is absolutely stunning. She has great connections. She has great knowledge and depth. So from a outside our facility perspective, we support them and we use them so that we're not all going in parallel. But that's not saying we haven't been part of various letter writing campaigns or such. And we had pleasure a couple years ago that our local member of parliament for the sitting government previous to this one actually had a loved one at the Pearly. And that was really interesting, because you saw a person who saw it from both sides. And that, I think, was really eye-opening for them. That was way more meaningful than anything we could have ever said to him, and said, this is what a day looks like in long-term care. He experienced it. So it was really that type of experience, I think, makes such a difference for those who are trying to understand what happens in long-term care.
Absolutely. And so you talked about, using the expertise of people who collectively do the big A, but focusing on, the local. With the work that you've done and the time that you spent as part of a member of a family council or working with Family Council Network, I'm wondering, I'd like to know, what are some lessons that you've learned or some bumps that you've experienced along the way? So Heather, I'll start with you and then I'll go to Julian.
Sometimes I think we're too hard on ourselves. We begrudge the fact that we don't have more members or that people aren't joining us in droves. That they say things like, "Oh, I really appreciate getting the notes from the meeting, but I won't be coming to the meeting." Yeah, I see what you're doing on the executive. It's really valuable, but that's not for me. And we feel that that's a failing on our part. And I think we just need to be more honest and and accepting of that. And it's going to ebb and flow. And, just all of a sudden, people will find a reason to be interested and they will join up. I must say the pandemic provided a real silver lining for us. A number of the executive were volunteers in our rapid test waiting room for essential caregivers. And that was 15 minutes of having to be in the same room and share. And sometimes we just shared jokes or ideas or quiet, and people got a chance to read peacefully for 15 minutes. But sometimes it was just to get to know people and their caregiver experience, and they got to know other things by sharing. So that was way more valuable in many ways than the various meetings we held during the time. So that was quite a silver lining because we had a captive audience.
Mm-hmm. Yeah, so the bumps can sometimes be getting caught up in the recruitment and the number of people and more just the mechanics of what you think goes into like treating it like it's a recipe versus the connecting with people, right? So going back to the talk about equity, just, seeing people and hearing their stories and laughing and, rapid testing. Nobody likes rapid testing, I'm sure. But, to make the most of that situation that you unfortunately needed to go through, that's great to hear that, you had that time to connect and build those connections. Mm-hmm. Julian, what about you? What are some bumps that you've experienced or lessons you've learned along the way with your work?
Well, I don't really have to say much because Heather said pretty well encapsulates it probably better than I can, but I can add on to what she said. First of all, is understand that each caregiver is going through their own experience. Each caregiver handles stress differently. Each caregiver has a different experience with their family member at different stages of healthcare. Of healthcare, they could be moderate, it could be severe. And I working with the family council and then even with the advocacy, talking to family counselors, it's all consistent. Extreme frustration at times, sadness, fear, empathy, but at the same time, commitment. That's the one piece of commitment that you see that throughout. Trying to do the best. There's no vested interest in I'm going to call it an essential family caregiver, other than to provide the best outcome for their family member or their loved one or their friend, whatever you want to call it. I'm going to stick with essential because they are. And I'll add to that a little bit later, but I think Heather said, I got much more out of just having these conversations one-on-one or a conversation on the phone. Heather and I, my wife, we spent hours chatting with people, sometimes pretty emotional stuff. And you could count on people because they understood. But if I were saying anything, it's really to trust yourself. And to know that and to know that you've got backup, and those bumps, they can be pretty significant. That you can butt heads with other family caregivers. You can butt heads with the administrator. You can butt heads with your PSW, and you can butt heads with the director of care or the nursing staff. Because I'm sort of a realist, and I like when the other fellow was on, he was talking about just the session, the one longer session there. I think he was talking about mental health and that sort of thing. I caught a part of it. That this positivity isn't always good. I agree. I agree. Sometimes you see things for what they are, and some people may not like it. And that's, nobody wants to be the outlier. I never wanted to be one, but at times I've had to be. And it's not a good position to be in. And other people can't do that. they have a fear, and it's a genuine fear. They fear retaliation. So you have to understand all of that, but in our case, I don't regret and I know I can speak for my wife somewhat, that I don't regret anything we've done. Nothing.
And then, so knowing the work that you've done, Julian, what are some of the best practices or promising practices that you can share when it comes to advocacy, either individually or collectively?
Well, I wrote some notes on that, but I think language matters, words matter, tone matters. You know, there are a lot of people angry and they're on social media and they're ranting. And I can get that. I get it, anger. And people will listen to a bit of that, but then they'll shut it off. And we got enough chaos going on right now, largely because we were inundated with all of this social media junk, which was supposed to open up the world, which actually has made it much more confusing. And we're not taking the time to take a breath. Shut it off. Go buy a newspaper and actually read it. Nothing wrong with traditional media. In fact, I'll argue I wish newspapers would come back. And for those who didn't grow up with them, it was pretty cool to read a newspaper every Saturday morning at a local cafe. It was cool. That's what people did with their latte or whatever. I just drank cheap coffee. But this non-political thing, if you get political, then you only appealing to the audience. You're preaching to the converted. I purposely, when I started back on Twitter, kept my tonality like this as best I could. I have my own personal political beliefs and moralities and philosophical beliefs and ethics. They're mine. But out there, when I was trying to look at things from what can actually work to help things move forward, is to touch the ones that weren't in so much agreement and now are starting to listen. Like I think Heather mentioned the lived experience, I'll call it, of an MP. All of a sudden you got their ears. I think I know who it is. And because now you're not having to justify. And the other thing I will say, and I don't want to eat up the time, but it's really important, is that you believe, if you are a caregiver and you actually believe you're essential, and you actually, because if you know that you're going to improve your loved one's health outcomes, their emotional state, you're going to give them the people-centered care we're all talking about, which is what we need to get to, then you walk into a room confident. And caregivers are essential, whether you're talking to a doctor, you have an inherent ability, you are an expert in your own right. If I were saying that to anyone, I'd say, remember that. Remember how important you are. You're not subservient to anyone. And finally, long-term care isn't free. It's not owned by the government. It's owned by the taxpayer, Canadians. It's not free. It's part of what should be our old healthcare plan. Somehow it got omitted. That's another whole topic. But the final point I'll make is come together and think about ageism. And this would never have happened if it wasn't for that, in my view. And it would never have been tolerated what we saw. I hope that kind of answers your question. I hope. That's a little bit of my rant.
Well, I think it's just, thinking about the tone that you're using when you're going to engage in your work, and just thinking about what would be most effective, what's the best way of doing things. And then also just thinking about the bigger social issues. So ageism, the World Health Organization last year released a report on ageism that I think applies equally to Canada as it does to any other place around the world, that apparently ageism is one of the most socially accepted and approved of forms of prejudice and discrimination that exist. So great points to touch on.
It was written in 1969. You can look it up, and it's on Wikipedia. It was coined in 1969. Take a look at I encourage anybody to read it. There isn't one word you need to change. And it's written, 40 years ago or 50? I don't know how long that is now, but yeah.
And then Heather, for you, what are some best practices or promising practices you can share about, your council, because you've been involved for quite a while. As you said, it ebbs and flows, but also in your council, working within the council itself and then working with the network, which is also in your region.
Within the council, and I think Julian covered especially the political connections, the government connections and such, and the importance of understanding and appreciating the moving parts there, because we kind of get battered around in the wind by what's happening there. Within the local council, within ours, one of the areas I think we're challenged by and we work hard on is to try and figure out when an item is a very local, personal item and very important to that caregiver, possibly very emotional to that care, or when it's more of a more systemic or general discussion or concern that we as a council can do something about. So it's not that if it's a one-off, it's not important and the person doesn't have really valid emotions about their concern, but it maybe isn't something that we as a group could make any substantial improvements on. We always have we consider a sort of a secondary aspect of our best practice is almost a contact center. So you have a concern with laundry getting lost. Well, the support services contact is here. The processes are there. The lost and found boxes are this other place. If that's not working, then the escalation path is. So just that local connections, lost laundry is probably not going to be a big advocacy item. But it's going to sometimes take 10 to 15 minutes out of a meeting because somebody's so passionate about it. So teasing out those items that we really can make a group difference on is really challenging and important. And that's a case, though, where the Champlain region in particular, because they're the ones that we touch base with most often, and FCO, especially from the olden days when I used to be able to go to Toronto for conferences live, is they will bring us sort of the topics of the day that they're starting to hear more about. And is that a concern? So they did a survey in the spring on IT support for families and how finances were managed, how flexible it was or wasn't. The finance side wasn't really of interest to us. It's not a concern. The IT side, especially now, is getting to be more of an area where there's an opportunity to help the residents, to help the families. So finding those areas that we can really understand and help to make a systemic difference on is really challenging, but it's really just the more rewarding because you found the golden nugget to continue on with.
And that's a great, insight of sharing how an issue might be in a meeting that someone is coming with that individual issue and you don't want to shut them down and lose their passion, right? You want to acknowledge them and let them be heard, but at the same point in time, you don't want it to take up all of the time that you have and take away from, that collective advocacy and that collective work that you're doing. So I like how you shared that practice of how, you make those connections so they're aware of how they can, the process to bring up those concerns in a way that they can still make sure it's addressed, that they're acknowledged for bringing that concern and speaking up. At the same point in time, you're able to focus on those things that are important to you. And it's interesting to hear about within a network that, the network, when it comes to what that network of groups of councils are doing, Sometimes some of the work may not be applicable to your council. So part of it may not be important. The finances weren't, but the IT was. And so you can kind of choose, again, selectively what resonates most with your own council's goals, and then bringing that back to kind of connect your own work with the power of that collective group of councils within the area. So it's been lovely to chat with you. I'm going to let you kind of wrap up and leave one last kind of word of wisdom you'd have to share for councils as they leave today, just based on, something that you heard in the conference or something that you've learned throughout your, time working with family councils, and then we'll open it up to questions. So Julian, we'll start with you.
Well, we have to be caregivers for the caregivers, for each other. We also have to, like, I look at family council, you, Samantha, everyone, Natalie, everyone. I don't know all your new support staff, but you're caregivers for us. And equally, I think we need to understand that, there's only so much negativity you can take. You need to hear some other stuff. So I try to remember that. But we are caregivers for one another. The other thing is, I'll wrap it up by saying stress and trauma. When we were fighting, working to keep and advocating for my mother-in-law, I call her my bonus mom. There was a lot of stress, but we were just charged, my wife and I. I was worried about the day after. And we went through a lot of when she passed. It doesn't feel like it's like you're in a different world. A lot of stress started coming out, and the trauma that is associated with that. And I just encourage people, if they need assistance, there's lots of resources. Like Wellness Canada is a super resource in Canada. It's free. You can talk to somebody. I'll be honest, I reached out to them. But when I say the day after, what I mean is once the COVID is gone and long-term care starts to drop off the political radar map, we're all sitting there going, but who's listening now? And I just say to people, support yourselves or go get some help. That's what I can say.
Absolutely. And Heather?
And take a bit of a different spin on it. I think one of the areas that I got out of yesterday in particular was the difference between equality and equity. And where I see that definition going to be very helpful to our family council is as families are pushing more for support for their loved ones. And we've had a lot of talk about the 4 hours of care. And I can totally imagine the meeting where we have somebody saying, well, my loved one's not getting 4 hours of care. They went out yesterday and after breakfast and they were off visiting their friends and they didn't get home till supper. So there's no way they got 4 hours of care. Whereas there's somebody else whose loved one needs one or two people to support them in almost every activity they do during the day, getting up, getting dressed, getting clean, getting fed, and clearly just have way more physical needs. So I can, one of my takeaways from yesterday was how to remind people of that. It's not equal. We're not going to go around and account on everybody's door a checklist of, okay, they're at 3 hours and 50 minutes today, check. It really is a more systemic, and that I see as one of our challenges going forward, because my sense is 4 hours is already outdated. Just watching what I've seen change in the industry in the last 15 years, the number of people who are 2 people transfers, the number of people who need significant help with feeding proportionally has gone up, and it has gone up at a rate much faster and much more intensely than the hours of care thinking. So we still are going to be challenged. There's still going to be lots of opportunity for how those key resources are prioritized and spent. So I think that's going to be a key focus for us going forward. So thank you. I got some tools out of yesterday that I think we can take back and use over the next while.
That's wonderful to hear. So we do have a question. So the question is, what suggestions do you have for new caregivers, so people who are new to long-term care, who want to engage in advocacy but don't know where to start or feel overwhelmed in their new role? So Heather, we'll start with you, and then we'll let Julian speak.
Well, we always like people to join our meetings, because I think they find at the meeting that they make connections. It is totally different now because it's online. We do Zoom meetings, so they don't always find the same person if they're in the halls on the way to their loved one's room, because there's a mask, no mask, they don't recognize. So that's a challenge. We don't have the knowledge by walking around that we had before. So the attending, I think, and therefore learning, understanding why a certain protocol has been put in place, what decision was made to allocate staff a certain way. They may agree with it, not agree with it, but they get a stronger sense of confidence that the decision was made with thought, maybe didn't come down in their favor for their loved one. So, and we always encourage new family members to reach out. But again, we may be hard to find because we're not present everywhere as much as we could have been before. So we're starting to use technology, phone, email, way more than we did previously to try and find those connections.
Agreed. It is definitely a challenge. You know, I mean, I'm glad to hear that you did use that one space for the essential caregivers, that they had to get tested so you could connect that way. But other than that, it is very much, you know, phone, email, finding ways to connect and, you know, thinking outside the box, which I think we've had to do a lot in the last little bit. Absolutely. Julian, what about you? What suggestions do you have for new caregivers who want to start getting involved in advocacy or may feel overwhelmed in their new role?
Well, I think the first one is to ask questions to your administrator or the home you're entering. Ask your friends that might have someone. Ask the hospital before the transfer occurs. What what support's there, and then make those calls that maybe don't want to say I need some help. I really look at when we got in there, it was like a foreign world when we walked into that home. There wasn't any support. When we didn't even know there was a family council at that point. It was a rush job. There was a 24-hour turnaround. For other people have experienced it. It was horrific, actually. And I'm working in the world where it's pretty tough. And I'm going, what? And then we're in there, and all of a sudden we're in this new place. Oddly enough, while the world of long-term care was very new to me and foreign, because I advocated for my mom and dad, I spent probably a year in a hospital. So that became like home to me, but I wasn't used to long-term care. So you really have to engage families, the administrator, and not be afraid to do it. That's really tough stuff to do because you're in an emotional state. But one thing I've noticed though, which is really cool, and you find like it's the family of family caregivers. Caregivers will come up to you if you're new and say to you, you need some help. I did it by default. And I've seen others do it. My wife did it all the time. You know, here's my phone number, doesn't even know the person. That's the sort of impact when people come together and for a common good. And I call it a common good. And so I guess the biggest thing I can say is just ask.
Absolutely. And I'm not seeing any other questions in the chat, so I'm guessing that everyone's just blown away by the wisdom and insight that you have both shared. And you've also touched on some resources that have helped you with your family council experiences, as well as your own experience as a caregiver. So thank you so much for taking the time to be part of this closing Fireside panel. We really do truly appreciate the insight that you've offered. And again, I'm hoping that, you take away from this session and this conference something that you can then share with staff or another member of your council. You can go back and have a conversation in your next council meeting and continue having discussions moving forward to support your council in finding your voice, because you are a very powerful voice. Thank you so much to Julian and Heather for joining me. And I'm now going to welcome Samantha Peck back so she can wrap the conference up.
Thank you.
Thank you, Kathleen.
Wow, what a way to end our time together with just such incredible wisdom from Julian and from Heather. And I know Bob would have had tons to share as well, so we'll have to bring him back at another time. Julian's point about reaching out for support, I think, is also part of what we talked about in resilience. So if you're someone who isn't perhaps the most likely to do that, set yourself a micro goal, as Dave suggested, and reach out because your peers will be there for you. As Heather pointed out, I think is a good way to summarize much of our time together is you need to understand what's happening in order to make a systemic difference. And that's really what councils are all about. Learning together, supporting each other, and taking action to improve the lives of residents, families, caregivers, and staff. Because at the end of the day, that's why you've chosen to spend your time with us over these past 3 amazing days. We've been able to talk about building equity in family councils and how that's different than equality. And Heather's point about taking that back, I think is one that we can all consider in our work. We learned how to build resilience, and while in an ideal world there would be room for all of the softness and the ease and the grace that we need, the place we're living in right now, this time, we do need to build our resilience. So check out the resources that Dave Donaldson has made available and share them widely. Amy and Alison today shared highlights from the data they have about the caregiver experience. That burnout rate is still shocking. So if you feel you're someone who's experiencing or maybe experiencing burnout, check out the resources they have to support your mental health and well-being. And consider working with your home if you haven't already done so to implement the caregiver ID. So that caregivers at your home will have the recognition and the support to be able to do their work as best as possible. When I asked this morning what you learned yesterday, so many people said residents' rights. So Laura's talk yesterday, I think, has definitely stuck with us all. We talked about research and centering lived experience with Dr. Flanagan. And I think that's also something to push for in your communities, is listening to stories and seeing stories as valuable sources of information. Quantitative data is important, looking at things like wait lists, satisfaction. But in order to, I think, to make a change, and also to Julian's point and Heather's around, talking to people, sharing stories, there's so much power in that. And putting values into action and being able to follow that action pathway all the way back and determine if you're doing the work you think you are in terms of living your values, and if that action really makes sense, and to listen to your gut if it doesn't, to explore that a little bit more deeply. So I want to wrap up by thanking you all for spending this time with us. On my team, to Kathleen for organizing and facilitating 2 fantastic sessions, to Leah for helping with all the comms materials, and monitoring the chats. Leanne, Tiffany, Natasha have been glued to their screens, making sure that everyone felt safe and comfortable in the chats, facilitating, responding, managing networking rooms. That's a few days good work. So go team. And Dinesh, the man behind the screen, who has been helping to troubleshoot the behind the scenes stuff and really organizing to make sure that we've got a great house-based experience. Couldn't have done it without all of you. And on that note, I'm Sam Peck. I'm the Executive Director of Family Councils of Ontario. It's been my pleasure to be in this virtual space with you all for the past several days. Videos are on YouTube. The resources are still available in your house space pages. Stay tuned for new announcements coming up about how we're going to continue these conversations and how we're going to continue using house space to provide learning, networking, and support opportunities. This was a pilot test for this platform, but I think we've gotten some good feedback so far. I know I've enjoyed the experience. So once again, I'm Sam Peck on behalf of the entire FCO team. Thank you so much to our presenters and our attendees. And we're going to call it a wrap on our fall 2021 conference, Finding Your Voice. Thank you so much. Reach out if you need anything, and be well.